Okay. All right. Good morning. I'd like to call this hearing to order. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today is Wednesday, February 11th, 2026. The time is 9:35 a.m. and this is a hybrid hearing with we have witnesses testifying both in person and virtual. Today we are here to discuss the FY25 performance of three professional health licensing boards: the Board of Pharmacy, the Board of Dentistry, and the Board of Optometry. We will also discuss the FY25 performance for the Food Policy Council. A little bit about these wonderful public service bodies. The Board of Pharmacy regulates the practice of pharmacy, pharmaceutical detailing, and pharmacy technicians in the district. The board consists of 7 members appointed by the mayor. The Board of Dentistry regulates the practice of dentistry, including licensing dentists, dental hygienists, and dental assistants. The board also issues certifications that allow dentists and facilities to administer general sedation anesthesia. The board consists of 7 members, also appointed by the mayor. The Board of Optometry regulates the practice of optometry in the district, including licensing optometrists and overseeing standards of professional conduct and practice. The board consists of 7 members. And finally, the Food Policy Council, which was established by the Food Policy Council and Director Establishment Act of 2014 to promote healthy food access, sustainability, and the local food economy in the District of Columbia. The FPC consists of 12 public members appointed by the mayor and approved by the council, and 10 ex officio members representing district agencies. The law requires the FPC to hold at least 6 public meetings each year, create working groups to tackle various priorities, and submit an annual report to the mayor and the council outlining the state of local food economy and food access in the district. The committee sent pre-hearing questions to the FPC and will reference those in the responses today. If anyone would like to see the materials that were provided by the agencies, you can go to the council's website, dccouncil.gov/hearings. I don't see any of my colleagues here, but should they join us, we'll certainly turn to them. We're going to turn to the public witnesses. Before we get started, I just want to review the guidelines. So all public witnesses will have 3 minutes to testify. It's not because we don't value what you have to say, but there are a number of people who are testifying today, and we just want to make sure that we get to everyone. It's performance oversight hearing season in the building. So we are time constrained because there will be another hearing in this very room later today. Okay. With that, let's get started. All right. So I don't see Robert Benson Branham. I don't see Patricia Stamper. All right. Gabby Hedrick. Am I saying she's on her way up? Like in the building around? Okay, good. That's great. All right. Nina Hamdami. All right. And Kate Urbink. All right. So hopefully Gabby gets here by the time that Kate is finished. We'll just talk slowly. Why don't you wait for a second, because for some reason this is speaking to me and it's distracting. So let me figure out how to turn the volume off. Hold on. It's fine. All right, cool. Great. Kate, when you're ready. Yep, you just hit that button and there you go.
Okay, thank you. Hello, my name is Kate Urbank, and I'm the Site Director of Food Rescue USDC. Thank you for this opportunity to speak to the importance of the DC Food Policy Council as it relates to my work in the field of food rescue. I'm pleased to report that we are celebrating a major milestone this year: 10 years of service and more than 15 million pounds of healthy edible food rescued across the DMV. Food rescue is one of the most efficient, practical, and environmentally responsible strategies to address hunger while reducing methane emissions from landfilled organic waste. Every pound rescued advances the district's sustainability goals while also supporting community organizations, and alleviating the burden of food insecurity. As a founding member of the DC Food Recovery Working Group, we were pleased that the DC Food Policy's decision to absorb that largely dormant entity into the Reducing Wasted Food Working Group. Under this new leadership, we are encouraged to renew and strengthen connections with other organizations focused on our issues. Our 10 years of impact would not be possible without strong public partnerships, largely made possible through our close collaboration with the DC Food Policy Council. Their coordination has paved the way for us to work alongside district government agencies, including DC Housing Authority, the Department of Public Works, Department of Parks and Rec, the Department of Energy and the Environment, the Department of Aging and Community Living, and DC Public Schools. For example, when the Food Policy Council learned that DACL had excess meals and no plan for them, they connected us so that food rescue is now their primary recourse when they have surplus. Similarly, when the council identified surplus generated through the free summer meals program, we were asked to step in to redirect those reels. Through this process, meal procurement at individual sites naturally became better aligned with the actual participation levels, reducing waste while maintaining reliable access to nutritious food for youth. To support the city's zero waste DC plan, we partnered with DPW to reinforce that food donation should come before composting or disposal. When DPW inspections uncover edible food in dumpsters or compost bins, agency staff alert us so we can reach out to those businesses, onboard them, and redirect surplus food to community partners. Over the years, we have provided ready-to-eat meals to 11 DC Housing Authority residential communities across the district. One of our closest collaborations is with James Apartments, and they receive 2 food rescues every Friday afternoon to help feed low-income residents throughout the weekend. Continued connection to DCHA through the Food Policy Council will help us identify additional housing communities that would benefit from food donation. When the Food Policy Council recognized that a lack of funding for aluminum pans was preventing food donation from DC public schools, they reached out to us and we were able to successfully secure grant funding to cover those costs, allowing a pilot program to move forward at 6 self-operated DCPS kitchens and enabling safe packaging and donation of surplus food. Looking ahead, we welcome the opportunity to provide guidance as the Food Policy Council prepares to publish a case study on DC government food waste and recovery, as well as a donation diversion toolkit for food businesses. We will contribute firsthand insight into what motivates businesses to donate surplus food, and we will also collaborate with DOEE on an updated version of the Commercial Food Donation Guide. Our work with these district agencies consistently demonstrates that the Food Policy Council plays a critical role coordinating and a continued strengthening of the council will be key to expanding collaboration, reducing food waste, and improving food security across the district in 2026 and beyond. We look forward to continuing to build a less wasteful Washington, D.C., one that promises food security for all. Did I make it?
Thank you, Kate.
You're welcome.
Gabby. Oh, Gabby's coming.
Good morning, Chairperson Henderson and members of the committee. My name is Gabby Hedrick, and I am a Ward 3 resident, as well as an assistant professor of public health nutrition at the George Washington University's Milken Institute School of Public Health. I also serve as Associate Director of Food and Nutrition Policy at the Institute for Food Safety and Nutrition Security at the university. I am honored to testify in strong support of the district's Food Policy Council and the Office of Planning's Food Policy team, and to urge increased financial and institutional support for their work. I began collaborating with the food policy team in March of 2024 during my first year on faculty at GW. Working closely with Caroline Howe and her former food policy analyst was essential in co-producing an applied research grant focused on dignified grocery access in Washington, D.C. Their partnership went far beyond a typical advisory role. Caroline and her team helped shape research aims and the approach from the very beginning. This kind of government and academic collaboration is very rare and deeply valuable. The grant went on to become funded by the Robert Wood Johnson's Foundation's Healthy Eating Research Program. It is one of 7 projects funded out of more than 350 submissions across the country. I am confident that our selection for funding was due to, in large part, to the food policy team's leadership, vision, and authentic commitment to community-centered research. As an urban food systems social scientist and registered dietitian, I design research that can directly inform policy, both locally and nationally, and that advances a more just and dignified food system for all residents. This work depends on strong partnerships with the district's communities and with residents like Ms. Patricia Stamper, who I believe is also testifying today. These collaborations simply would not be possible without the coordination, trust building, and policy expertise of the Food Policy Council and the Food Policy Team. They are a critical bridge between data, community experience, and actionable program and policy change across all 8 wards. The Food Policy Team also plays an important educational role. In my classrooms at GW, their engagement is consistently ranked by my students as one of the most meaningful components of the course. Offering this kind of real-world public sector learning experience requires time, staff capacity, and protection from overextension, especially as the team continues to advance essential work for the district. All of this, the research partnership, the community engagement, policy translation, and student learning, requires people, time, and a fully supported team. For these reasons, I urge the Council to sustain and, if possible, increase funding and staffing for the Office of Planning's Food Policy Team. With strengthened resources, their ability to collaborate with academic institutions like mine, with community organizations, and with residents will continue to grow, and the district will be better positioned to promote food security and nutrition equity for all. Thank you for the opportunity to testify today.
Thank you. Just to say it again, is there a Nina here? Oh. Oh, okay. I think she switched to virtual, so we'll try over there. All right. Well, thank you so much for providing this testimony today. It's good to hear feedback about how the Food Policy Council is doing and their engagement, not only with the community and organizations like U.S. Food Rescue, but also your students. Excuse me, as well. Professor Hedrick, you made a suggestion in terms of providing more resources for them. Is this from a staffing perspective or something else? And I mean, what
Yeah.
more do you feel like they could be or should be doing?
Yeah, I think staffing capacity is the key request to continue to build out their team, because this would allow for more diverse collaborations, whether that be with universities in the classroom or building out more research-oriented activities as well.
Okay. Any challenges working with the Food Policy Council thus far? I know this is very awkward because Caroline's like right behind you,
No,
but that's okay.
it's truly, I'm not just saying this because Caroline is right behind me and as well as Julia, but it is truly like the joy of my career to be able to work with them. It's what I look most forward to. I canceled meetings this morning to come here in person to tell you how much I care about them and the collaboration. And it really is what continues to motivate me to do this work, both research-wise and classroom-wise.
That's great. All right. Well, I don't have any further questions, but thank you. Thank you both for being here. And please make sure you upload your written testimony for the record. Thank you. Okay, so we're going to switch to the virtual. For the folks joining us virtually, if you haven't testified with us before, you'll need to affirmatively accept our invitation to become a panelist. There'll be a little box that pops up on the screen. We're going to do the, okay, hold on one second. We're going to do groups of 5 just to kind of see where we go. All right. Kurt Gallagher, Eric Angel, Siobhan Healy, Max Broad, Ashley Ruff. Okay, we don't see Ashley, so we're going to do Jaron Hill Lockridge. Again, there's a little box that pops up on the screen. It says, I'd like to be promoted as panelist, and you do have to affirmatively accept that. Okay. We've got some folks. So, Kurt, why don't you go ahead and get started?
Thank you, Chairperson Henderson and members of the committee. My name is Kurt Gallagher, and I serve as the Executive Director of the DC Dental Society. Today, I'm here to testify on behalf of our 400-member dentists who care for the public and the residents of DC. My oral and written comments will focus on 2 critical questions about the performance of the Board of Dentistry. First, to what degree is the Board advancing policies to improve workforce shortages that continue to confront dental practices? And second, to what degree does the Board provide public opportunities to offer comment on policy matters under consideration by the Board? Regarding the first question about workforce shortages, We're encouraged that the board continues to be willing to advance the practice of dentistry and make changes to the scope of practice of oral health professionals. We support two changes that are under consideration by the board currently. And the board does have a heavy docket this year, so there will be other proposals that will be coming up later on in the year, and I'll address some of those in my comments. The first is authorizing level 1 dental assistants to take radiographs. We're in support of that. We're also in support of a proposal to clarify who a dental assistant may assist and may supervise a dental assistant. There's a third proposal that came up in the December Board of Dentistry meeting that has raised very severe concerns among our members. And this is a proposal to wrap into the scope of practice of dental assistants cleaning, sanitizing, and sterilizing functions. The board provided no justification for this highly restrictive change. We cannot find any similar registration requirement in the DC municipal regulations from the Board of Administration, Board of Medicine, or other boards for staff who perform the listed cleaning, disinfecting, or sterilizing functions in other healthcare settings, and that includes in hospitals or doctors' offices. We understand the rationale for requiring registration of dental team members as a dental assistant if they are in a position that provides direct assistance to patient care. However, the employees we're talking about do not work chairside and are not involved in the hands-on delivery of dental care to patients. Therefore, they should not be required to register. It's also important to note that sterilization techs are an important entry-level position in dental practices, and we've seen employees start out in these positions and work their way up as assistants, dental hygienists, and even dentists. We do support other changes and advocate for other changes to the scope of practice of dental assistants and dentists. All those details will be in our testimony, but a couple of highlights. One, authorizing level 2 dental assistants to perform coronal polishing and place pit and fissure sealants. You may recall that this committee established a level 3 dental assistants that included those two functions. However, in the nearly 2 years since that position was created, only one person has successfully registered as a level 3 dental assistant. So clearly the expansion of the support that could be provided by a dental assistant is not being achieved by people who are able to register as level 3. Authorizing level 2 dental assistants to perform these functions would be similar to the approach that the board is discussing to authorize a level 1 dental assistant to take radiographs. We also advocate for removing redundant registration requirements if the board and this council is going to maintain the position of level 3 dental assistants. There are redundant requirements that is one of the barriers for successful registration. We also advocate for creating a pathway for internationally trained dentists and internationally trained dental hygienists to be licensed as a dental hygienist in DC. The shortage of dental hygienists continues in DC with significant impacts the ability of dental practice to provide care to the public.
Mr. Gallagher, you're about, almost a minute over.
Oh, no, I'm sorry. Thank you.
All right, thank you. Eric.
Good morning, Chairperson Henderson. My name is Eric Angel, as I guess you know, Executive Director of DC Greens, and I testified today in strong support of the Food Policy Council. For a decade or so, the FPC has been a critical part of DC's health equity infrastructure, driving improvements in health access, health outcomes, and community well-being. Its leadership, coordination, and community-centered approach have made it a truly effective entity serving DC residents. Our mission closely aligns with that of the FPC, building a just and resilient food system, advancing health equity. DC Green's work is grounded in the belief that food is health, food is medicine, food is a human right. A key example of that mission is our Produce RX program that you're familiar with, the oldest and largest produce prescription program in DC. We also operate the Well at Oxen Run, community farm and wellness space in Ward 8. We'd love to have you come once the growing season starts. These programs succeed in part because they operate within a policy environment strengthened by the FPC's leadership. The FPC's working groups, transparent public policy processes reflect the competence and care required to move meaningful policy forward. And as you know, the FPC has been accomplishing more with fewer resources. DC Greens helped lead the effort to establish the FPC in 2014 alongside DCCK, then Councilmember Che, and many others, because the district needed a dedicated government embedded body focused on food and health equity. A decade later, that vision has proved essential, but the awful problem remains. Far too many residents, particularly those experiencing poverty, food insecurity, still face preventable diet-related illnesses and death. That is why we need all of our sister organizations pushing for change and the FPC. On a side note, when I was preparing for this testimony, I found the 2020 testimony of Kate Lee, DC Green's then farm director, who took time out of her testimony to express her profound appreciation for Ona Balkas. In her words, Ona has brought vision, organization, forward motion, stronger sense of cohesion to the work of the council supporting subgroups. I'm a huge fan of Ona. In her current role, been thoroughly impressed by Carolyn Howe as well and her colleagues at the FPC. When budget season comes, we're going to strongly support the priorities of the Fair Food for All DC Coalition, expanding food as medicine programs, strengthening urban agriculture, ensuring equitable food access, priorities that are deeply aligned with the FPC's mission. For this reason, we will without hesitation support funding and increase funding for the FPC when the time comes. We at DC Greens envision a future where nutritious food is fully integrated in DC's healthcare system and where every resident, regardless of zip code, has access to the resources they need to thrive. Achieving that future requires strong support of the council and a fully supported FPC. Thank you so much.
Thank you. Siobhan?
Good morning, Chairperson and members of the Council. Thank you for the opportunity to testify again. My name is Siobhan Haley. I'm a licensed dental hygienist in the district with over 2 decades of clinical and public health experience. I'm the founder of the Capital Coalition of Dental Hygienists and Dental Assistants, a group of dental professionals working to improve access to prevention-focused oral health care. I'm also a member of the DC Oral Health Coalition, which I acknowledge today, though I am not representing it in this testimony. I want to acknowledge the Board of Dentistry for its work following the passage of the Dental Hygiene and Dental Assistance Scope of Practice Amendment Act of 2023 and for its interest in understanding workforce challenges. As the Council conducts oversight, I want to start with collaborative practice agreements because they represent the most immediate evidence-based opportunity to expand access, strengthen prevention, and stabilize the workforce without lowering standards. These agreements allow hygienists to deliver preventive care in community settings through collaboration with dentists. This model has been implemented successfully in other states, improving access and oral health literacy while strengthening, not replacing the workforce. Despite this, there has been no meaningful progress on regulations for these agreements, even as other rules moved quickly after the 2024 law. Without finalized regulations, hygienists cannot enter into these agreements, leaving the Council's intents unrealized. I also want to address the workforce proposals involving foreign-trained dentists. National data consistently shows that negative workplace environments, like limited autonomy or excessive productivity pressures, are major drivers of workforce attrition in dentistry. If these conditions are not addressed, expanding substitute labor pathways will not solve the problem. The board's testimony raises the idea of licensing foreign-trained dentists as hygienists without explaining why this is needed or how it improves prevention, access, or patient safety. If the goal is to leverage foreign-trained dentists, a more direct and equitable approach would be to create pathways for those dentists to teach and practice dentistry directly, particularly in Medicaid settings and communities lacking specialists. At the same time, the district should prioritize pathways for foreign-trained hygienists to practice in DC. Dental hygienists are the only oral health professionals educated and trained specifically to prevent disease and manage it non-invasively. Strategies that ignore this expertise risk higher costs and worse outcomes. Finally, a governance concern. DC has 8 wards, but only 7 board seats. More dentists, of course, than hygienists, and no dental assistant representation. Workforce decisions are being made without proportional input from the professionals most affected. As part of this hearing, I urge the Council to ask, why have collaborative practice agreements regulations not advanced? How workplace conditions are being evaluated as a driver of workforce shortages, and whether the board's composition reflects today's oral health workforce and the district's equity goals. Thank you again for the opportunity to testify.
Thank you. Max?
Hello, Councilmember Henderson and staff of the Committee on Health. My name is Max Broad. I'm a member and co-chair of the DC Good Food Purchasing Program. We're a coalition of over 30 businesses, nonprofits, and DC stakeholders working with DC government on improving our food systems. The concept is rooted in values-based procurement, essentially procuring food from our local and BIPOC-led businesses and choosing goods that protect workers, improve nutrition, and reduce harm to animals and the environment. I'm excited to say there's momentum growing around this movement as values-based procurement takes root, and the public sector is working in tandem with DC community and business stakeholders. This includes players like DC Public Schools working with DC GFPP, the Jail Food Working Group, and Department of Corrections, and of course the Food Policy Council working to enhance the impact of these efforts across the board. In the past year, the DC Food Policy Council has hired additional staff, which has expanded the repertoire in DC's food procurement. In this time, we've seen the Food Policy Council do several things, including creating a contract dashboard to track the status of food-related contracts in the district and when they're up for renewal. This is extremely valuable as contracts are often very opaque and it's unclear about what's going on and where there's opportunity to improve contracts. They've worked with the Department of Corrections to include values-based procurement in their request for proposals for their new food-based contract renewal. And then also they've developed best practices for values-based procurement to be incorporated into future contracts, any contract that deals with food besides Department of Corrections. But more broadly, the Food Policy Council has been instrumental in keeping the central food processing facility moving forward. This is a potent tool to assist values-based procurement in the district by giving our city more authority over the food we store and prepare. They've also been involved as active participants of many of these efforts, including in the DC Good Food Purchasing Program. So all that to say, the Food Policy Council initiatives align well with DC GFPP goals around values-based procurement. We look forward to testifying in support of the Food Policy Council Procurement Amendment Act, and we'll have suggestions on ways to continue and strengthen DC's efforts at that hearing. But we want to emphasize how meaningful the Food Policy Council's work has been to harness the power of purchasing to support local businesses and our community. The Food Policy Council team has been really great to work with, and it's an honor to continue that work and just want to support it. Thank you so much.
Thank you. Ashley Ruff. All right, Jaren.
Good morning, Chairperson Henderson and members of the council. My name is Jaren Hill Lockridge, and I serve as the chair of the Ward 8 Health Council and as the director of strategic partnerships at Dreaming Out Loud. I am here today to speak about the food landscape in the Great Ward 8, the role of the Food Policy Council, and the need to understand the food and medicine landscape east of the river. As you know, for nearly 20 years, the Ward 8 Health Council has served as a clearinghouse for coordination in a fragmented healthcare system. And today, that same fragmentation exists across our food system. On paper, there are several organizations that are serving Ward 8 through federal nutrition programs, city-funded initiatives, nonprofit food distributions, and several food as medicine programs. But in reality, we as residents are still navigating disconnected systems while managing the social determinants of health. Food insecurity in Ward 8 is not just about distance, but about affordability, cultural relevance, reliability, and dignity. This is why food policy must recognize that food is medicine, and medicine must recognize that food is also infrastructure. Through my work at Dreaming Out Loud, I've seen that this work is best when it's rooted in a local food system with trusted community partners. And this is the reason why the Marionberry Avenue Market and Cafe exists. It's more than a space, it's infrastructure, it's economic infrastructure, and it's clearly a community anchor. It's increasing our access to food, culturally relevant food, and creating pathways for farmers and local residents to be involved in our economic system. And the Food Policy Council has played a critical role in strengthening and sustaining the cafe. So we urge the council to prioritize institutional procurement that supports things like the Marionberry Avenue Market and Cafe, to align the food as medicine funding with community-rooted retail and distribution infrastructure, to ensure that cross-agency coordination between health, human services, small businesses, and economic development is clear, and most importantly, to treat food as community infrastructure, making sure that it's essential, that it's not supplemental, that our food system is also an economic system, and that when we invest in local food farmers and entrepreneurs, we invest in wealth building and economic mobility. As the food policy continues its work, I urge you to ensure that Ward 8 is not simply included in strategy, but resourced through structural investment. Um, let's also commit to transparency and accountability in the outcomes. Ward 8 does not need more short-term programs, but we need durable systems that treat food as infrastructure, community leadership, and health equity that's non-negotiable. Thank you for your continued leadership, your continued partnership, and I look forward to answering any questions that you may have.
Thank you. Thank you to this whole panel of witnesses. It's always, we're all talking about health, but when we talk about food and we're talking about dentists, I just think that's a good mix. Is Miss Healy still here? Great.
Yes, I am.
Hi. Okay. I have a couple of follow-up questions, and they have me on a clock as well to keep myself honest. You mentioned in your testimony, well, a couple of different things, but one that sort of stood out was around decisions being made for the workforce, but certain parts of the workforce not being at the table. As you know, it feels like a blur, but it was only like a couple of years ago where we did a health occupation revision and a lot of revisions to scope of practices as well as size of boards and things like that. Are you suggesting that the Board of Dentistry be expanded to include dental assistants at the table?
Expanded to include another dental hygienist representative. Right now, there's only one seat for dental hygiene. And yes, to include a position for dental assistant representation.
Okay, so there actually is there's a second dental hygienist seat. It's just currently vacant. And there hasn't been a nominee for that seat sent to us yet, but there is a
So Chairperson Henderson, it's my understanding that there's 7 total seats, 5 allocated for dentists, 1 allocated for a dental hygienist, and 1 allocated for a public member.
then perhaps my records might be off dated, but I have that there are 2 vacancies on the Board of Dentistry. Is that?
I'm aware that there's only 1 vacancy, and that's the public member seat.
Okay. All right. Thank you.
Thank you.
I did also want to ask about, well, if you could submit your testimony for the record, I'd love to read more about your thoughts around foreign trained dentist pathways.
Yes.
And in general, we have been trying to look at ways or just pathways in the health profession altogether for someone who might be foreign trained. And we actually passed legislation about that is at DC Health. I'm starting to sense a bit of a tension in terms of while the staff at DC Health want to move forward and implement, some of the boards are a little dated in their thoughts around foreign trained individuals in their particular professions. And so we're going to have to sort of work through some of those particular issues on that front. But thank you so much for being here.
Thank you. It's my pleasure.
Kurt, we'll ask some follow-up questions about some of the things that you talked about. I too noted, well, I mean, based on what I have in front of me, unclear if it's accurate, but that I have here that there's only 1 dental assistant at level 3 that has been registered. And that was a bit curious to me as well in terms of what happened there or what is happening, as well as in some other areas why we are, I don't know, maybe not, I don't know, maybe not, 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 Um, why do we require a separate license for teaching dentists? And perhaps there just needs to be some further cleanup that happens on that front, which we'll get there. But thank you for being here. Eric, thank you for being here. I've been out to the farm in Ward 8. I was there when it was opened and dedicated, and I've
I didn't mean to suggest otherwise. I'm
no,
sorry.
I have. It's a beautiful space. It's a great space. And we'll certainly talk more to the Food Policy Council around some of these connections in neighborhoods. But, Ms. Lockridge, as you're sort of talking about food as community infrastructure, it can't just be a one-off program, but building in something deeper. And so we'll ask some follow-up questions on all of these good things. But thank you all so much for being here. I don't have any further questions for this panel. Thank you.
Thank you so much.
All right. Nina Hamdani, Allison Powers, Lindsay Smith, Yuki Kato, and Patricia Stamper. Again, you need to affirmatively accept our invitation to become a panelist.
Council member, my technology is not letting me leave. Eric Angel here. So if someone kicks me out, that'd be great.
Okay, hold on one second.
Oh, wait, now it is.
Okay. All right. Nina, when you're ready.
All right, thank you so much. My name is Nina Hamadani, and I'm a registered cottage food producer that's been in business for about a year and a half. I make Persian flavor baklavas that's a unique twist on the classic, and I'm grateful for the opportunity to provide virtual testimony today regarding the DC Office of Planning Food Policy team. I'm sorry I couldn't be there in person. Caroline Howe and Ashley Stevens have been invaluable throughout the entire process, from sharing their knowledge and answering my many, many questions prior to my cottage food registry application, through recommending that I take advantage of the mentorship program offered by DCSBDC, to hosting their informative monthly DC Food Policy Council meetings, where I'm kept up to date on district food producer policies, programs such as the Ward 7 Shared Commercial Kitchen Grant, and licensing changes like the Thrive Act. For example, it is only through the FPC that I found out about the 2025 changes to DC code allowing cottage food businesses to wholesale and enter the retail market. In my opinion, this is an absolute game changer, as many times I'd been asked if wholesaling was available and was often met with disappointment when my answer was no. My goal is to grow my food business in DC into food service and pastry cases around the city. This change to the code nicely lays that foundation while protecting against the failure risk of leasing a commercial kitchen too soon. With the change to the code, I can instead look forward to entering the wholesale market as a cottage food producer, and then scaling up when the time is actually right to enter a commercial facility. Furthermore, I'm personally counting on the FPC's upcoming collaboration with DLCP to develop roadmaps for food business growth. It is my opinion that DLCP is developing these roadmaps and standardizing information for food business owners in the district as a direct result of intervention, advocacy, and leadership by the DC Food Policy team. In short, I'm grateful for the guidance, knowledge, enthusiasm, and encouragement that Caroline and her team bring to ensuring the DC food scene is vibrant, no matter how tiny the enterprise, like my own. My business, The Persian Table, would simply not exist without the bridges created by the DC Food Policy team between myself as a producer and DOH and DLCP. I wanted to offer my testimony today, which I'm doing for the first time ever, to both recognize the value provided by the DC Food Policy team and also express how much I'm looking forward to their work developing transparent pathways for growth for DC food businesses. Thank you for your time, and I'm happy to answer any questions.
Thank you. Allison?
Hello, my name is Allison Powers. I am the Director of Economic Opportunities at Capital Impact Partners. It is an honor to be testifying today as a DC resident and native on behalf of the Food Policy Council. Capital Impact Partners, part of the Momentous Capital family, is a nonprofit organization and a community development financial institution, or CDFI, that has deployed over $24 billion across the country. In May of 2021, Capital Impact was selected to manage the Nourish DC Collaborative as a partnership of technical assistance and lending organizations, including the Washington Area Community Investment Fund, or WACIF, Latino Economic Development Center, or LEDC, City First Enterprises, Dreaming Out Loud, and Eats Place. The goal of Nourish DC is to foster an inclusive food system that provides access to healthy, affordable food with a focus on locally owned businesses in wards 5, 7, and 8. The impact of this program is both food access and also economic development and quality jobs. Since 2021, DEMPIT has provided $4.5 million in investment from the district, which has allowed us to leverage $3.3 million in private funding and deploy over $20 million in financing to local DC food businesses, the vast majority in Ward 5, 7, and 8. Over the past 4 years, we have also provided $2.8 million in grants to food businesses, technical assistance to over 1,500 food businesses in DC, and created or retained over 870 jobs. The origin story of Nourish DC is years of advocacy from the DC Food Policy Council and community members who cared about food access and job creation. The DC Food Policy Council has continued to be a part of the advisory committee and helped to keep the goals of the program aligned with the current needs of a fast-changing food environment. I've relied on their deep expertise in local food systems and been impressed with their connection to community through active listening and outreach. In 2025, we worked closely with the team on the Resilient Food Systems Infrastructure Program, or RFSI. The purpose of this USDA grant program is to build resilience in the middle of the food supply chain and provide better markets for small farms and food businesses to support the development of products for consumers, fair prices, wages, and new job opportunities. This grant will provide $1.4 million to middle of supply chain businesses, which represent meaningful economic change and wealth creation opportunities for district residents. The DC Food Policy Council understands how to leverage these opportunities to increase procurement for local businesses and provide more locally grown food to district residents. DC Food Policy Council is the connective tissue between the different food and small business programs throughout DC. An increase in funding would not only impact Nourish DC, but all the programs that focus on food and small business, especially those that have encountered historic barriers to growth, accessing TA and capital. I have been inspired by the passion and determination of the team to expand their scope of work and meet their goals despite decreases in staff capacity. Many of the food businesses that we work with through Nourish DC have commented that the current challenges that they are facing are even worse than the pandemic. The DC Food Policy Council needs increased resources to implement meaningful change during this critical time.
Thank you, Allison.
Thank you.
Lindsay?
Good morning, Councilmember Henderson. I'm pleased to be here to share my support for the DC Food Policy Council and continued investment in its capacity. My name is Lindsay Smith, and I'm a Ward 4 resident. I've been working to strengthen our region's food system since 2007 in various capacities. I currently staff the Metropolitan Washington Council of Governments' newest policy committee, the Farm Committee. Farm's mission is to support a more resilient, secure, equitable, and connected food system across our region's urban, suburban, and rural communities that will provide for more of our region's food needs. I'd like to first acknowledge and thank Councilmember Zachary Parker for his continued leadership as one of Farm's vice chairs. DC's Food Policy Director, Caroline Howe, also serves on the Farm Committee and is a highly engaged member. Her team is also consistently engaged in one of Farm's regional staff-level work groups, which provide peer-to-peer support and technical assistance to its members. Here are two examples from this past year of how the Food Policy Council team's work here in the district has contributed to building a more resilient regional food system. During last fall's government shutdown and unprecedented withholding of SNAP benefits, COG staff provided ongoing updates on the status of federal actions, litigation, and more importantly, how the district, Maryland and Virginia were responding to support our region's SNAP participants. In the interest of time, I will skip the various diverse groups this was shared with, but suffice to say, Carolyn was always available during the crisis to verify, clarify, and add to the information we provided on the district's response. I'm still receiving positive feedback on these regional communications as recently as last week from 2 farmers in Prince George's County, one of whom also farms in DC. As a second example, I'm thrilled that the district was able to bring on a new food policy analyst leveraging the RFSI grant program that Allison just mentioned. We're already seeing the benefits of this position to the region. Kashaf Momin helped to plan a greatly oversubscribed second annual Regional Food Aggregation and Distribution Summit that was held in mid-December. She's also jumped in to support the district's work to develop interagency collaboration on food procurement. This work provides helpful, relevant findings for other interested COG members on a critical way that we could potentially save money and invest in healthy food access and our local and regional economies. The tools and information that the food policy team has developed for the district's work will also provide broader benefits. In December, the Farm Committee launched a local food procurement challenge to encourage member governments to shift more of their existing food spending to local and regional food. Thanks to the work of the DC Policy Council team and its collaborators, the district is extremely well poised to participate. I know that I am over time, so let me just say that the remainder of my testimony speaks to the need for continued investment in their capacity and our food programs generally, particularly given what's happening at the federal level. Thank you so much.
Thank you. Yuki? Apologies if I pronounced that incorrectly.
No problem. Good morning, Chairperson Henderson and members of the committee. My name is Yuki Kato. I'm a resident of Ward 6 and an associate professor of sociology at Georgetown University. I've been conducting research on urban agriculture over a decade, including in Washington, D.C., and today I'm here to testify on behalf of Food Policy Council with a specific focus on its urban agriculture working group. I've been an active member of the DC Food Policy Council's Urban Agriculture Working Group since its inception in 2015. The group has been instrumental in connecting urban farmers across DC to share resources and to represent their concerns. Throughout 2025, Carrie Vaughn and Kate Lee, until her departure from Office of Urban Agriculture, had been organizing bi-monthly farm tours across the city, which was open to public and which was well attended, with more than a dozen participants in each on each tour. And there were a handful of regular attendees, but I would like to also emphasize that there were many other folks who came for a few of them, which really sort of shows the scope of the outreach that these tours actually created. And the tours have become an important space for us to meet each other, because oftentimes urban farms are very busy sort of doing their own work in their own spaces. But these spaces also allows us to see how different practices of urban farming exist across the district. And then also, more importantly, where we were able to share some information to gain understandings about opportunities and challenges that are being experienced by many of these growers. Currently, there is no other organization or group that actually has this kind of a reach for all urban growers across the city. And in fact, my understanding is that the Carrie Vaughn and others in this group have worked to facilitate and for the modified water rate for 2 of the urban farms with the DC Water. Beyond the working group, I've been working with Karen Howe, who's been doing a fantastic job as a director of the Food Policy Council in making the information about the scale and scope of urban agriculture across the city more publicly accessible. And so in order to recognize the number of urban growers that have been providing produce, honey, flour, compost to DC residents, and also a lot of different programming for various age groups and skill sets. And I would like to underscore that the potential of urban agriculture to address food insecurity has been demonstrated during COVID-19, and also, as Lindsay just pointed out, during government shutdown. And I anticipate that this role will continue to be significant as we anticipate the economic and political uncertainty in the near future. And I'd like to point out that Gabby Hedrick, who testified earlier, also has done work
on affordable housing and urban agriculture. In closing, I'd like to emphasize that the importance of continued funding for DC Food Policy Council, particularly with regards to urban agriculture, if the DC is to attain what was outlined as a goal in Sustainable DC 2.0 for 20 additional acres by 2032. Thank you very much.
Thank you. Patricia Stamper.
Hello. Hold on, let me pull up my testimony. I want you guys to see this. I'm right here at 320 40th Street Northeast. This is a failed promise of the city to bring us another grocery store. I'm here in Ward 7 at one of the most atrocious, trifling grocery stores. I've seen rats, roaches, water bugs. It's not cute at all. That needs to be remedied as soon as possible. However, I just want to point out, I apologize for not coming down there in person. The traffic was horrible. But with that being said, good morning. I'm a former commissioner and current member of the GW University Community Advisory Board. I'm here today to speak about the fundamental truth. We are what we eat. Currently, our neighbors east of the river are facing crisis of consistency. When EBT SNAP benefits are withheld or delayed due to administrative hurdles, it's not a glitch. It's a direct hit to the health and dignity of our residents. We cannot expect families to thrive when their primary source of nutrition is tied up in red tape. I'm calling on the council to ensure that the distribution of these benefits is treated with urgency it deserves. I want to highlight the vital support I have received in my capacity, specifically as a CAB member and former commissioner. Specifically, I want to thank Caroline and Dr. Gabby from GW. Their commitment to sharing resources and their hands-on support has been essential as we work to bridge the gap between academic research and community reality. I'm working with Dr. Gabby and GW team has allowed us to look deeper into the systematic barriers facing our neighborhoods, such as this. This haven't just provided data. They have been provided a partnership that respects the expertise of those who live and work east of the river. We're defining dignified grocery access east of the river. Through my work on the Community Advisory Board, I have been searching for the answer to the one question: what is dignified grocery access east of the river? Because this ain't it. Okay, I just want to point that out. This right here ain't it. I like going to the Safeway on Kentucky and 14. Okay, so equity of choice, having the same high quality, organic, fresh options available in Ward 7 and 8 that are standard in Ward 3. Environmental quality, shopping in stores that are clean, well-staffed, and welcoming rather than feeling like second-class consumer. I never forget, me and my friend, my homegirl, went to a Safeway in Ward 3. Tell me why the Plan B was right there on the shelf, able to grab for her. She didn't have to go push a button, be embarrassed, go through all those administrative hurdles just to get something she needed. That was her right and what she needed for her body. Health is a right. We are what we eat. Then a lack of fresh produce in our neighborhood is a direct statement on how the city values our lives. I urge the DC Council to continue its support of the Food Policy Council and to prioritize the voices of those of us on the ground. We aren't just looking for access. We're looking for the dignity that every Washingtonian deserves, even here at ANC 7F. Thank you.
Thank you. Thank you, Pat. Thank you to this panel of witnesses. Oh, we do have one more person. Ashley Ruff.
Good morning. Good morning.
Good morning.
I'm gonna turn my camera off because I'm actually at work, but I need to be able to see my testimony, and I'm just going to break it down because it is long. But I did combine everything that I wanted to testify today under that testimony. So give me a second.
Okay.
Good morning, Chairman and members of the committee. My name is Ashley Ruff, Commissioner for ANC 7FO2 in Ward 7. First, I want to acknowledge the Food Policy Council for the light it continues to shine on food equity in the district, especially east of the river. The council has helped elevate conversations that too long have been ignored, naming food deserts, naming structural inequities, naming the disparities, naming and all of those things that matter. But shedding light on inequity must also lead to structural change, because in Ward 7, food access is still a struggle. We have a disappointing lack of healthy grocery store options, limited sit-down restaurants, fresh markets that are not always fully funded or constantly operating. There's no train station in between all three of our in between all three of our grocery stores. Um, I apologize for that. Also, at the same time, we have a saturation of 24/7 tobacco stores and corner markets selling highly processed foods that link to cancer, diabetes, hypertension, and other chronic diseases that disproportionately impact Black and Brown communities. This is not an accident. This is structure and equity. Also, I want to address the visible disparities, just as my other colleagues have, with the different Safeways. Our Safeways are run down in Southeast and in Northeast, but when you go down to 14th and Kentucky, it is like you are at a upscale Costco's. So I don't know if that resonates for everyone that is listening to this testimony today, but it does resonate for POC commissioner, and not only that, the mother that is actually trying to find equitable food options for my household. And as far as for the Board of Pharmacy, we can't talk about pharmacy access without talking about food access. Pharmacy deserts and food deserts overlap each other. Ward 7 also has an issue with finding pharmacies. And we also contribute to the highest rate of diabetes, high blood pressure, and heart disease, all going back to these 24-hour tobaccos, lack of pharmacies, everything that overlaps and goes back to pointing out that food equity is important, especially in the east of the river communities. We're going back to talk about dentistry. When we have these highly concentrated places in our community, our children's teeth are rotten to the core. They have different types of cavities. They need root canals. So you're talking to a mother that needed those services. When it comes down to optometry, what do they tell you back in the day? You need a carrot to be able to see. Most of our kids can't even get glasses because, hey, guess what? Our doctors are no longer supplying glasses for our children that are on Medicaid. And so with my testimony and my 10 seconds left, I want you all to just imagine this for your own communities, not just in Ward 7 or 8. It is about all of us being united, but Ward 7 and 8 are being left behind in food equity. And it does add up to all of the other things that we need as far as pharmacy, dentistry, and optometry. Thank you for my time.
Thank you, Commissioner Ruff. You covered a lot in your 3 minutes, and I want to commend you for the use of your time, but also for talking about the linkages, which you're absolutely right. It also links to what Ms. Stamper was talking about in her testimony, right? When you have standalone pharmacies or independent pharmacies that are closing, now the pharmacy that folks have to rely on are the pharmacy in the grocery store. Well, if the grocery store isn't a place where people want to go, in theory, yes, it should be a one-stop shop situation, right? I get my grocery shopping, I pick up my prescription, and I can move on, but that's not what's occurring. And, Commissioner Ruff, we've talked about the need in terms of access to dentists, particularly pediatric dentists, and we had a conversation a couple of weeks ago with Director Turnage around network adequacy, around who's taking Medicaid and not taking Medicaid, and why are they not taking Medicaid, or new patients for particular populations. The question of optometry is an interesting one. It was also through the HORA to learn the difference between the optometrist and the ophthalmologist. They do different things, y'all. And you probably should visit both, but not a lot of people realize that. But also, how do you do that? And when we look at the census in terms of the number of optometrists or let's see, optometrists, ophthalmologists who are currently licensed in the district, the numbers are not as high as what we would think, or I don't know. I would love a cushion. So anyway, I look forward to talking more with those boards about some of those things that were raised. Ms. Hamdani, are you still here?
Yes.
Hi. Okay. So first, in the room, folks would love a sample.
I'm sorry, I couldn't be there in person.
I know. But in the future, when you do come visit, we would love the opportunity to support one of our cottage food businesses. I did want to ask a question, though, in terms of, in your testimony, you talked a lot about how the FPC was very informative in terms of providing updates on regulations and laws and things like that and changes. But for the FPC, where else might you have found that information?
That's the thing. I don't think I would have received it in any other way, in any other consolidated way. I would have had to just be independently motivated to continually check on DC code to see if the changes were updated. I honestly don't think I would have known.
Okay. I think that speaks to a gap that we have on our side in terms of allowing businesses to be able to receive updated information. The cottage food industry is very different than perhaps our restaurants or our retailers or otherwise who are paying associations to basically keep track of what's going on, regulations, and what's changing. And I think as a policymaker, the worst thing that we want is for us to make this change that we think is going to help people, but then people don't know about it, so they can't actually take advantage of that, because we want to see businesses grow, stay, and thrive here in the district as well. Okay. Ms. Stamper, I just want to acknowledge, thank you so much for your testimony. Your observations about that particular location for where you are in the parking lot are shared. And there's some differences in terms of the limitations of what the Food Policy Council can do. And you know that because you've worked with Caroline and her team. But that's certainly something that we can raise with the Deputy Mayor for Planning and Economic Development, as it also seems as though their priorities have shifted around grocery store creation, particularly in wards 5, 7, and 8, where, again, there is still continuous need as we keep cutting ribbons in Ward 3 on grocery stores. But that's something that we have to continue to work on. But I don't have any further questions for this group. If you could all please make sure you provide your testimony for the record. Commissioner Ruff, please make sure you give us your testimony because I feel like I want to be able to use that as a model. She got a lot in 3 minutes. Okay.
Practice makes perfect. Practice makes perfect. We've been practicing.
No, but I mean, I just feel like as we head into budget season, some people might need models of how to stay within their time, but get your message fully across. Anyway.
Yes.
All right. Well, thank you guys so much. We're going to go to our government witnesses. So we're going to bring up the chairs of the 3 boards all together, and then we'll do Food Policy Council on its own. So Dr. Allison Hill, who is the chairperson of the Board of Pharmacy, Dr. Michelle Latour, am I saying it correctly? Okay. For the Board of Dentistry, and then Dr. Lisa Johnson, who's the chairperson of the Board of Optometry. Don't be shy, come join us. Okay, Dr. Hill, when you are ready.
Good morning, Chairwoman Henderson, and members of the Committee on Health and staff. I'm Dr. Allison Hill, and I have the honor of serving as chair of the District of Columbia Board of Pharmacy. On behalf of Mayor Muriel Bowser and DC Health Director Dr. Ayanna Bennett, I am pleased to provide this testimony on the Board of Pharmacy's activities and overall performance in fiscal years 2025 and 2026 to date. I'm a licensed pharmacist and a proud resident of Ward 7 with extensive experience advancing pharmacy practice, regulatory affairs, and professional development. My main practice area is community pharmacy. I began my service on the Board of Pharmacy in 2020 and was appointed chair in January of 2025. My background includes leadership roles in national pharmacy organizations, policy development, and advocacy for expanding pharmacists' capacity to improve population health. In addition to my role on the board, I serve as Director, Professional Affairs at the American Pharmacists Association, where I lead initiatives to advance sustainable pharmacist-provided patient care services. I'm also an active member of the National Association of Boards of Pharmacy, where I contribute to policy development, law enforcement, and legislative initiatives impacting pharmacy practice nationwide. My experience in regulatory affairs includes analyzing and interpreting pharmacy statutes to propose changes that enhance patient care. The mission of the Board of Pharmacy is to protect and improve public health through the effective regulation of pharmacy practice and pharmaceutical detailing. This includes licensing pharmacists, pharmacy interns, technicians, and pharmaceutical detailers, and ensuring compliance with regulatory standards that promote patient safety and high-quality care. The board is made up of 7 members, 5 licensed pharmacists, 1 licensed pharmacy technician, and 1 consumer member. As of February 1st, 2026, the board licenses 2,220 pharmacists, 886 pharmacists with vaccination authority, 319 pharmacy interns, 1,362 technicians, 167 technician trainees, 972 pharmaceutical detailers, and oversees multiple pharmacy technician training programs. The board made it a priority in fiscal year 2025 to advance key regulatory actions that expand patient access to pharmacy-provided care. One major achievement was the issuance of final rulemaking within Title 17, Chapter 65, which established the regulatory framework for pharmacists to prescribe and dispense self-administered hormonal contraceptives. With these regulations, pharmacists seeking to utilize this authority must attain certification that demonstrates the appropriate competency to prescribe these important medications. The Board of Pharmacy is building out the training and certification process so this authority is accessible to eligible pharmacists. This rule represents an important step in increasing access to timely reproductive health care, particularly for communities that face barriers to traditional care. Research shows that pharmacists are the most accessible healthcare providers, with 9 in 10 Americans living within 5 miles of a pharmacy, and patients visiting their community pharmacist approximately twice as frequently as they visit a primary care physician. In fiscal year 2026, the board's priorities are focused on addressing remaining implementation needs tied to recent legislative and regulatory changes. The board continues to offer training opportunities to healthcare professionals licensed in the district through its vendor, DCRX. The board is supporting the ongoing implementation of expanded vaccination authority for pharmacists by raising awareness of the Community Health Amendment Act of 2025. This expansion allows pharmacists as recognized healthcare providers to order and administer all immunizations recommended by the appropriate medical and public health authorities. The board will continue ensuring that expanded vaccine access is implemented safely and consistently across the district. Looking ahead, the board remains committed to advancing regulatory updates that align with modern pharmacy practice, supporting workforce development, and strengthening collaboration with stakeholders. Our goal is to continue integrating pharmacists more fully into the healthcare continuum by expanding access to care and reinforcing the critical role pharmacists play as accessible, community-based health access points, often serving patients who may not otherwise engage with the healthcare system. Pharmacists are uniquely positioned to provide timely interventions, preventative services, and trusted patient counseling, ensuring pharmacy professionals are supported in the environments where they practice. I would like to express my gratitude to my fellow board members for their service and dedication, and to DC Health staff for their support. On behalf of the Board of Pharmacy, I appreciate this committee's commitment to advancing pharmacy practice and healthcare access in the district. Thank you for the opportunity to testify today, and I welcome any questions that you may have.
Thank you, Dr. Hill. Michelle.
Thank you. Good morning, Chairperson Henderson, members of the Committee on Health and staff. My name is Dr. Michelle Tortu, and I have the honor of serving as Chair of the District of Columbia Board of Dentistry. On behalf of Mayor Muriel Bowser and the DC Health Director, Dr. Anna Bennett, I am pleased to provide this testimony on the Board of Dentistry's performance in the fiscal year 2025 and our achievements in the fiscal year 2026 to date. I've had the pleasure of serving on the Board of Dentistry as a licensed dentist since my initial appointment in 2021. During my tenure, I have served on the Communications Subcommittee to ensure licensed dental professionals are aware of any regulatory, policy, or other licensing-related updates. After 3 years of board service, I was appointed as chair of the Board of Dentistry. As chair, I lead our monthly meetings, approve orders and agreements, and consult with staff on dentistry regulatory matters. Outside of my board service, I have practiced as a licensed dentist in the district for over 7 years. This includes my current role as the Chief Executive Officer and founder of District Dental Services, a nonprofit organization that provides dentures, partials, and other related procedures to low-income and other underserved communities in the district. I received my doctorate of dental surgery from Meharry Medical College, School of Dentistry, and there I completed I completed a dental residency at St. Elizabeth's Hospital in the district. These experiences, both educational and professional, reinforce my commitment to providing equity-focused, high-quality dental care across the entire district. The Board of Dentistry is charged with regulating the practice of dentistry through its 7 members, 5 licensed dentists, 1 licensed dental hygienist, and 1 consumer member. The board issues 7 different license types, and as of February 1st, 2026, the licensure census was 1,194 dentists, 714 dental hygienists, 200 dental assistants level 1, 625 dental assistants level 2, and 1 dental assistant level 3, and 3 teaching licenses for dentists. Aside from licensing, the board the board is also responsible for reviewing complaints and conducting disciplinary hearings when needed. The board received 27 complaints in fiscal year 2025 and has received 14 thus far in fiscal year 2026. When appropriate, DC Health staff investigate these complaints and refer them to the board for disciplinary action. This board's function is crucial to ensure patients have access to a safe and high-quality dental care system and supports the broader healthcare ecosystem. As dental professionals play a vital role in identifying early signs of systematic conditions, preventing complications, and connecting patients to timely medical care, our work helps reduce avoidable emergency department visits, supports chronic disease management, and improves overall public health outcomes in the district. Over the past fiscal year, the Board of Dentistry has concentrated on strengthening its internal operations and supporting the district's dental workforce. 3 new members were appointed to the board, with 1 consumer seat still awaiting appointment. The board implemented a permanent policy for incentivized registration of dental assistants, giving unregistered individuals a responsible structured pathway to comply with district law. Under this process, both the dental assistant and their supervising dentist or practice owner submit applications, pay the required fee, and complete board-approved continuing education and ethics. If the dental assistant was not previously registered, they may enter a 90-day supervised practice period while completing the remaining requirements. Since launching this effort, the board has seen a marked decrease in the number of unregistered dental assistants. We also expanded transparency by maintaining a publicly available list of board-approved continuing education providers. Fiscal year 2025 also included the approval of district's first dental assistant level 2 registration, reflecting the board's efforts to expand career pathways for dental assistants and strengthening the oral health care workforce. This new level of registration supports great skill development, allows dental assistants to take on more advanced duties under appropriate supervision, and helps practices meet patient demands by increasing the availability of trained personnel. The board also completed one of the most significant operational transitions in recent years. Experiences, both educational and professional, thank you. Okay. Okay. Moving to a date of birth renewal model. This shift replaces the previous single month renewal cycle, preventing tens of thousands of licensees from renewing simultaneously. The board is currently in the late renewal phase, which will close on February 28th, 2026. Going forward, this new renewal system will result in a smoother, more efficient process with improved support from practitioners. The board is currently working to expand the scope of practice for dental hygienists in areas that support both patient access and public health. This includes developing certification pathways for dental hygienists to administer vaccinations under dental supervision, prescribe topical fluoride products and antimicrobial rinses, and perform blood glucose testing. In addition, the board is preparing to stand up stand up the district certification process for dentists and dental facilities to administer sedation and general anesthesia. Other priorities for the upcoming fiscal year include accessing whether a pathway should be created for foreign-trained dentists to become licensed as dental hygienists, reviewing collaborative practice agreement provisions, and examining telehealth considerations for dental care. As we continue this work, I want to acknowledge the many stakeholders, advocacy organizations, educators, and industry partners who provide valuable feedback and partnership in supporting the board in DC and DC Health. On behalf of the Board of Dentistry, I thank the Council for your continued support and investment in the district's healthcare workforce. I appreciate your time. I appreciate your time and the opportunity to testify before the Committee on Health, and I look forward to any questions you may have for me.
Thank you. Dr. Johnson.
Good morning, Chairperson Henderson, members of the Committee on Health and staff. My name is Dr. Lisa Johnson, and I have the honor of serving as chair of the District of Columbia Board of Optometry. On behalf of Mayor Muriel Bowser and DC Health Director Dr. Ayanna Bennett, I am pleased to provide this testimony on the Board of Optometry's performance in fiscal year 2025 and our achievements in fiscal year 2026 to date. As a native Washingtonian, I have the pleasure of serving on the Board of Optometry as a licensed optometrist since my initial appointment in 2002 and as chair since 2021. I have been practicing optometry for over 40 years and have provided eye care to several patient populations, including children, seniors, and people with disabilities. I received my optometry degree from the Pennsylvania College of Optometry and my Bachelor of Science degree from Bennett College. I served as president of Bennett College's National Alumni Association. Currently, I serve on the Association of Regulatory Boards of Optometry's nominating and OE tracker committees. These experiences, both educational and professional, reinforce my commitment to equity-driven, high-quality eye care across all 8 wards. The Board of Optometry is responsible for licensing optometry professionals through one license type and a mandatory additional therapeutic pharmaceutical agent authority. The Therapeutic Pharmaceutical Agent Authority allows optometrists to provide, dispense, and administer specific therapeutic drugs. As of February 2026, the board's licensure census included 230 optometrists with 1 pending application for licensure. The Board of Optometry consists of 5 members, 4 licensed optometrists and 1 consumer member. Currently, there are vacancies for 2 optometrists and a consumer member. Aside from licensing optometrists, the board is responsible for reviewing complaints and conducting disciplinary hearings when needed. This is a critical function to ensure patients have access to safe and high-quality eye care in the District of Columbia. The board received 2 complaints in fiscal year 2025, both of which were investigated and resolved. Thus far in fiscal year 2026, the board has not received nor investigated any complaints. As chair of the Board of Optometry, I am constantly reminded of the important role that optometrists play in the overall healthcare ecosystem. Given the importance of eye care for overall well-being, it is critical that the board ensures there is a well-trained, competent optometry workforce to meet the patient's needs. In fact, individuals living with vision impairment or blindness reports have more difficulty accessing health care. Fortunately, the licensed optometry workforce has remained stable in the District of Columbia, and practitioners continue to work on providing positive eye health outcomes for all residents. Over the past year, the board voted to update the optometry reference form for applicants. This updated form offers additional insights into the professional character of an applicant and ensures that the board is licensing the best optometry professionals to serve patients. In fiscal year 2026, the board will continue to enhance the scope of practice for optometrists to improve the quality of eye care for District of Columbia residents. This includes evaluating how optometrists can best provide treatment for glaucoma and other significant optical conditions. Permitting optometrists to practice using their full training and skill sets will support earlier optical treatment, thus decreasing delays and further potential loss of vision. Additionally, the board is planning on suggesting a telehealth policy to appropriately regulate what optical care can be rendered virtually. These parameters will increase the reach of licensed optometrists to residents who may have difficulties in accessing optometry services. This policy will be reviewed at the next Board of Optometry meeting on April 9th, 2026, and finalized by the July 2026 meeting. As we continue to make improvements to promote access and patient safety, I would like to acknowledge the many stakeholders, including advocacy organizations, educational providers, and industry representatives who have provided input and support to both the board and DC Health. On behalf of the Board of Optometry, I thank the Council for your continued support and investment in the District of Columbia's healthcare workforce. I appreciate your time and this opportunity to testify before the Committee on Health, and I look forward to any questions you may have for me.
Thank you. Thank you to all of you for not only testifying, but also for your service. As many of you have been serving on the boards for quite a bit of time. Okay, I have some questions for everybody. Let me start with some questions I have for all of you. So I know that there is it's a term referred to as delegated authority. Can you just remind me whether or not your boards have that, which allow for staff to approve or deny routine licensing decisions between board meetings? Dr. Hill?
Yes, we do have delegated authority to staff, and we just updated those procedures December.
Okay. Dr. Latour, too?
Yes, we do.
Okay. Dentistry is a yes. Dr. Johnson?
No, we don't.
You don't. Interesting. Okay. Right. Do you, for pharmacy and dentistry, do you all do a periodic sort of audit, if you will, to look at how many applications were approved or denied under delegated authority over the past year?
We don't do an audit, but then prior to every board meeting, we're given that information. So it's in a part of our agenda that we approve during our board meeting.
Okay.
Same. We go over it during our monthly board meetings.
Okay.
Mhm.
All right. Okay. So over the past year, has your board adopted any policy changes to reduce the barriers to licensing or speed up application processing? So one of the things that we haven't, or for some of you, we weren't able to find is like, what is the average processing time? Which frankly, when it gets to our level at the council, it's somebody who's like, I've been waiting for 87 years to get my license and I can't get it back, and one of the things we try to track is the average amount of time that it's taking for the licenses to be processed. Is that something that you all look at for the board?
Yes, we do look at the average processing time. I actually have the dates, the days that it took for fiscal year 25 versus fiscal year 26.
Okay.
For most of those, they did decrease, but this is the first year that our staff is having to deal with the rolling approvals. So we did expect a little bit of getting used to that, and that was
By the birthday as opposed to the 1 year.
the once a year, correct?
Okay. Okay. Overall, how do you all feel like that change is working for your members? Going from once a year to the birthday?
So optometry is just about to do a renewal.
Yep.
It'll be ending March 31st.
Okay.
So after that, we will start the birthday renewal process. Um, we're sure it's going to be very unfamiliar to our licensees and very confusing. But I'm sure after we get through a 2-year period and everybody's on board, it should probably be smoothly. It works smoothly.
Okay. Yeah. Have you all sent out, I'm imagining you sent out advanced communication to let people know
that is coming?
Yes.
They are nodding their head, yes.
Okay. Okay. All right. And then, there was some public witness testimony that was talked about, how do we transition or welcome in or onboard in individuals who have been foreign trained, but can contribute to the workforce, whether it be in dentistry or in other, I think it's more dentistry than other things. So the Department of Health Licensure Pathways Amendment Act is currently in effect. It allows DC Health to provide assistance to internationally trained health professionals. How has dentistry coordinated with DC Health on the implementation of this?
Well, this is actually, we're actively, reviewing this because, we have, monthly meetings that are open to the public, and that was a concern of theirs. So we're figuring out how to implement that. So we actually haven't, set anything in stone yet.
Okay.
In regards to that. We actually were looking into, seeing what other jurisdictions close to us, say like Maryland, Virginia, Delaware, how they're implementing foreign trained dentists.
Okay.
And also a bit ago, why we implemented the teaching licenses. That's actually a way for foreign trained dentists to practice in the district. Once they get when they get a teaching license, they can, practice at Howard.
Oh, I see.
Mm-hmm.
Okay. Oh, that helps to explain. I was wondering, why would anybody get a teaching license if I could just be a licensed dentist? That didn't make sense. So that is a pathway that you all sort of established in that realm. Okay. All right. Let's talk about vacancies. Dr. Johnson is like, this you and a friend.
Yep, absolutely.
The board is supposed to have 5 and there are only 2 of you. So if one of you don't show up,
We don't have a meeting. Well, they said we can. There's
That-
some way we can have a meeting.
yes,
But
but that it's weird
Right.
because it's saying if you have quorum of the people who have been named, which means one of you constitutes as quorum, but I feel like that's awkward for one person to be making decisions on behalf of the entire licensing board.
Absolutely.
So, what steps are you familiar with any steps within DC Health taking to try to get some more folks to join you?
We have been sending out, every meeting we post this, if you want to be on our board, this is the steps that you have to take. Asking, fellow optometrists, DC residents and non-DC residents.
No, we changed it to.
I know, that's what I'm saying. It's been changed, and we've had a couple of applications sitting and waiting, but no action on them. So, and
Okay.
we don't have definitely don't have a consumer member. So,
All right. I'm a phone a friend. Someone from DC Health who want to chat about your conversations with Moda.
Mhm.
No, I'm talking to the folks behind you. Like all of them doing not it. What's that? You want to send a follow-up? Nobody wants to come to the table? Come on, Naisha. We don't bite. Good morning. Oh, you just turn your mic on.
Good morning, everyone. Aisha Nixon. So our collaboration with the Mayor's Office on Talents and Appointments, we do meet with them regularly. We meet with them monthly to discuss what vacancies we have, how we can help support putting the word out. So as Dr. Johnson stated, we noted in all of our board meetings, any communication that we send out to all of our licensees, we let them know of the vacancies, provide the links in which they're able to uh, submit their applications. And also when people are identified through MODA, we do work with them to interview them, assess why they're interested in being on the board. From the DC Health perspective, we kind of just give feedback on what it means to be on the board, what the obligations are, what the expectations are, and how they would serve, the length of the meetings, the
basic info.
yeah, housekeeping. So we do know that there are some individuals in the pipeline that are getting vetted for some of the various boards that are up here at the moment. But again, we are not part of the process of the appointment, but we are working with them, and we do try to make sure that the communication goes out, and they've been in collaboration with us to ensure that we are up to date when they do have applications. If they don't have any applications, we, inform the boards to kind of spread the word.
Okay, so then let me ask this question. Dr. Johnson mentioned that there was 2 people who submitted applications. Have they gotten to you all in the DC Health conversation yet, or no?
Not to my knowledge.
Okay.
But that does not mean it has not. I am not the direct executive director for that board, so
Okay.
they may have had discussions with MODA with the potential applicants.
Okay. And then what about for the Board of Pharmacy? What I have is that there are 4 active members out of 7 authorized seats. Is that
So for the Board of Pharmacy, I know that I can confirm the exiting executive director, we have an interim at the moment, did sit with MODA for, I think, 2 applicants. And so that information is with them.
okay? I just, I mean, this is less for you guys and more for Moda who's listening. The licensing boards are critical.
They are.
They're super critical in terms of making sure we're maintaining a robust healthcare workforce and that folks are able to be licensed so that we don't have unlicensed practice happening. When we get to a place where there are only 2 active members on a board, or even 1, we had that a year ago with professional counseling where she is seconding herself. That's not good practice. And I think it sets us up for potential challenges to when there are decisions made about a person's license and also mistakes being made. And so if people are eager, now, yeah, do the vet, but like, it's not like 40,000 people are knocking on the door to say, I want to serve. So I feel like we need to hold on to that. But okay. Thank you, Ms. Nixon. Thank you. Let me ask though, the Board of Pharmacy, it had vacancies in executive leadership and the supervisory pharmacist positions. They were relying on interim appointments and requesting waivers during the district, when we had the hiring freeze, last year. Did those vacancies impact licensing and processing inspections?
It definitely had some impact. We did get the approvals for to place individuals in the interim role, so that helped foster continuity of the work. So I will say it was minimal impact for the Board of Pharmacy and the Pharmaceutical Control Division. The uh, executive director for the Board of Pharmacy, that position has been posted and an offer has been made. And then for the supervisory pharmacist, we did not have any interested applicants who submitted resumes. So that is a position that will be posted soon.
Okay. Alrighty. Okay, so for the Board of Pharmacy, You had several open session meetings in 2025 that were, in our view, kind of largely procedural. So you moved very quickly into a closed executive session. You all did this in January, July, September, and November. What type of issues are discussed in closed session, and how do you sort of address transparency in terms of people who might attend your public meeting only be a part for you all approving minutes and then voting to go immediately into closed executive session?
So our executive session is used for disciplinary matters. We have been, for our February meeting, we did go back into open session and disclose how many of those disciplinary matters were closed and handled during our executive session meeting. For the most part, our open session, we encourage public comment. Unfortunately, we don't get a lot of public comment, but that's what our main, after our approval of our minutes and our announcements and our census numbers and any other information that does need to be shared along with our updates from our legislative and regulatory committee, then we go into public comment. But most of the time, the public does not have any comments.
Okay. Okay, that's helpful. So a couple of weeks ago, we had a hearing for Department of Healthcare Finance, and there were a number of public witnesses who testified about Alliance and Medicaid beneficiaries having trouble getting their prescriptions at pharmacies for a variety of reasons. So I just want to ask you this in terms of get some clarity. Does the Board of Pharmacy disseminate any changes in the Medicaid and Alliance programs to frontline pharmacists, especially pertaining to changes in access to prescription drugs? Or is that something that is mainly only communicated through healthcare finance?
So the Board of Pharmacy does not handle that, but the Pharmaceutical Control Division handles that communication and information dissemination.
Okay. And would the Board of Pharmacy also know how many district pharmacies contract with Medicaid?
That would also be Pharmaceutical Control Division.
Okay. About 877 pharmacists currently hold vaccine administration authority, according to the board's December 2025 census. Are we seeing this number increase at all over time, given that we are trying to make more of a concerted effort to make pharmacies as a place where folks can go to get routine vaccine visits?
I don't have the numbers from 2025, but it is something that we do encourage. And as board chair for our past couple of open session meetings, I make sure to bring up vaccine and immunization issues just to make sure that everyone is aware, especially when we had the differences with the new act that was passed of 2025.
Yes. Um, let's say I'm already a licensed pharmacist. What is additionally required for me to do the vaccine administration authority?
There is a 20-hour CE, continuing education, that is sponsored by a provider that pharmacists must go through this 20 hours of continuing education. Then they submit that certificate to Department of Health staff, and then they pay their fee, and then they're allowed to immunize. And they also must do their CPR and OSHA training too.
CPR and
OSHA training.
What's OSHA training?
It's the Occupational Safety and Health Act.
Okay, thanks. We use a lot of acronyms around here, so I just got to ask sometimes. Hopefully it was not a test. Okay. The Health Occupation Revision Act expanded pharmacists' authority to administer pre-exposure prophylaxis, also known as PrEP. Since this authority was implemented, have you all received any feedback in terms of how many pharmacists have actually taken this up?
don't have any information about how many pharmacists have actually utilized this certification.
Okay. All right. Now I have a question. Just stick with me because I can't give you all the info, but there's a purpose, I promise. Okay. Pharmacist in charge license. When a pharmacist in charge retires or resigns or otherwise leaves an organization, what is supposed to happen?
If the pharmacist in charge knows their exact date, they're supposed to submit that information to Department of Health staff, and the new pharmacist in charge is supposed to also sign on that form. It's a easily downloadable form that has the old pharmacist in charge, then the new pharmacist charge, and then also the effective date. And that should happen within 30 days.
Okay. Is there any transition or grace periods during which a pharmacy or an agency may continue to operate under a former PIC's license?
If the PIC is not there, then they're not allowed to do that.
Okay. How does the board identify and address situations in which a license may be used beyond what is permitted? Would it only come to you all via complaint?
Yeah, usually complaints or from the Pharmaceutical Control Division, because they also monitor when they do their inspections, they check everyone's licensure.
Okay. That was helpful. Thank you. All right. Dentistry. Okay. So application processing times weren't included in the Department of Health's performance oversight responses for your board. What's the average time that it's taking for a dentist application these days?
I can't definitively, tell you the exact time, but I, well, we have noticed that there was a large number of, hygienists and dentists. They did complain that, it was taking some time, but ever since, we implemented the, delegated authority. Well, yes, well, delegated authority. But I've definitely noticed that, there've been significantly less. Well, we haven't even received any complaints that it's taken.
That's great.
Yeah.
But I also like to trust and verify. So that's why I'm asking the question, but we could follow up with DC Health in particular, because this is something that they should track. I think they track for all the boards, which is how long is it taking? Because that's the only way we know if we can, if there are some excessive times, but also how we can get better in that. Okay. So per your December meeting minutes, the Regulatory Affairs Subcommittee proposed adding an additional radiography pathway for the level 1 dentist position. This was intended to be a beginner level entree into the profession. So what's the purpose of adding this pathway to an entry level position? And do you all not feel like that would be have a negative impact in terms of folks being able to come on in?
No, well, level 1 dental assistants, they're unable to take x-rays. So, there have been concerns, and, the public has stated that in order, uh, they're not necessarily satisfied with the amount of, responsibilities that, levels of dental assistants have, right? So, uh, both assistants, hygienists, they're sharing that it'd be a lot, and dentists share that it'd be a lot easier, for level 1s to be able to take x-rays, so it can kind of free up, things can be more efficient in, dental clinics. So there'd be more people working there that are able to actively take x-rays. Okay?
Yes, but
So-
I think the question I'm still having though is my understanding is that level 1 is supposed to be like the entry of the entry.
Yes.
And when you continue to add additional requirements to it, that makes it harder to enter.
Well, it's not a requirement. It's more so an option.
Okay.
So, what we're considering is implementing that ability for a level 1 dental assistant to receive additional training just to be able to take x-rays, but they don't it's not
It's not a requirement.
yes.
Okay. Okay. So in the HORA in 2025, dental hygienists and dentists can enter into collaborative practice agreements, which means that dental hygienists can practice in clinical and community settings upon receiving a dentist authorization. The board said in December that you hope to have draft regulations for early 2026. What's the status of this?
We actually haven't had our for initial 2026 meeting yet.
Okay.
Yeah, so we actually didn't we didn't have quorum last month, so we will follow up.
Okay. All right. We just don't want to have delays that go stretch far into 2026, into 2027. Okay. Following up again. So the Regulatory Affairs Subcommittee is supposed to be working on language to clarify that the supervising dentist and a practice owner are responsible for ensuring that dental assistants are practicing within their scope of practice, which I think makes sense, right? It shouldn't be on the onus of the dental assistant to say to her supervisor, no, I'm not supposed to do that. I feel like that can create some tensions there. What's the status of this language and the expected timeline for board action?
We had to have our meeting yet because this is actually on the agenda.
It's on the agenda?
Yes.
Okay, so when's your February meeting scheduled for?
Next week.
Okay, all right. Okay. All right, we talked about some of the okay, just to add for clarification, because you mentioned around the teaching licenses for dental, that was added as a pathway to allow for foreign trained folks to be able to practice.
Yes.
Is that the same for the dental hygienist teaching license as well?
Yes.
Okay. So at what point, if I have a teaching license, can I then convert to a full-on,
Well,
let me just be.
there's not necessarily a conversion, right? So you can work, at work as, an educator.
Okay,
And then
so
while you're and then, take the course, actively take the courses to become a dentist or a dental hygienist here. So, you'd have to go to school again.
so my foreign credentials are good enough for me to teach in America students of my profession, but my foreign credentials are not good enough for me to practice?
Well, yeah, independently outside of the dental school, no.
You see how that doesn't make sense, right? I could train the next generation of American dental school dentists and dental hygienists, but I can't practice myself. Okay. For someone from that particular board's executive leadership team, can somebody explain this to me? How long has this been a thing? is it a law? Is it a regulation? Like, what is it? Because for us to say your credentials are good enough for you to teach in America, but you can't practice here, that is weird to me.
So I will speak on behalf of all professions
Okay.
when it comes to not it's specific to dental or dentistry.
Okay.
So it was the Board of Dentistry created that pathway for the teaching license to assist with foreign trained individuals who have the capability and capacity to be able to educate and the new dentists, but it also gives them the opportunity to go back to school. I think when putting it into perspective, the Board of Dentistry in the District of Columbia has the authority to license and develop regulations for the minimum competencies, but there's also national standards. And so in order for someone to become a dentist, you have to pass their national exam. You have to graduate from an accredited program. And so this is, again, the avenue to allow someone who is coming with those credentials that may not be their school that they're coming from, may not have been deemed that their accreditation is similar to the level of that in the district. So I will use nursing, for example. Someone may graduate from a nursing program in another country. Then their credentialing services that are here within the United States that will assess their transcripts to determine if their education is equivalent to the education received here. Sometimes they will say that what you receive there is equivalent to a BSN here in the district, a bachelor's of nursing. But sometimes they might say, no, it's not equivalent, and the education you receive is equivalent to that of a licensed practical nurse, which would be that of an associate's level. And so again, it is not the board's creating this pathway was, again, trying to get people in. So that they then can have the opportunity to pursue and take the additional coursework that they may need to then be able to sit for the national exam. Because those are things that we may not be approving you to sit for.
Yeah.
You have to go to their testing body, produce your transcripts, and they determine if your education is substantially equivalent.
Okay. It still doesn't make sense that we say you could teach, but you can't practice. Like,
so
that's odd, but
yeah.
I appreciate that we have tried to make a pathway for folks to be able to do that. I just feel like overall, in general, for some of these larger associations and boards and things like that, if we have a healthcare workforce shortage in the United States writ large,
But I think
have people who want to be here, despite everything that's going on in this country, they actually want to be here.
So nationally, I think a lot of the national associations related to the health professional boards are looking at workforce capacity, what it means if they don't have a pathway in existence for foreign trained individuals, how they can help and how they can kind of help with those collaborations. Again, for states or jurisdictions, we are limited at times because of the national requirements for individuals to enter into those professions. But even on a district level, we are looking at what existing foreign pathways we have already, and then how we can help create additional pathways for individuals who are coming from another country.
Okay. Thank you. Thank you for that clarification. Dr. LaTortu, I'm sorry, I'm not picking on you, but this is my last little bit. So I think it's more of an issue of the three boards. Your board probably has more of an issue with unlicensed practice than the others. I don't think you really could be an unlicensed pharmacist. I mean, no, legally you cannot. And I think it would be really difficult for someone to try to do unlicensed practice with optometry because your equipment is so expensive. Literally would walk in and be like, this is not an eye doctor situation. But people out here allowing random folks to saw off their teeth. I'm confused.
It's only assistants. So
Okay.
so
So we don't have the veneer problem
No.
in DC?
No.
Okay, great. That's a Florida issue, I guess.
I guess so.
Okay.
But the issue that we really have is unregistered dental assistants.
Okay.
Yeah. So a lot of they have to renew, their registrations like hygienists and dentists do. And well, there's been, an issue with they don't renew, or they don't get that initial registration, and then they get hired anyway. um but it's well we you know established,
Mhm.
what I read
Yeah.
earlier.
So, I mean, I think it's just more about exposure. We need to inform folks like, no, dental
Yes.
assistants do need to register.
Yes, but we've been effectively getting the word out, and there actually a lot have been coming forward,
Okay.
to and then have actively been working with us so they can get their registration, keep their job, and not get heavily fined.
That's good.
Yeah.
Okay. Dr. Johnson, similar to what was happening with Board of Pharmacy, when we look at the open meeting minutes, it's pretty standard of like approve the agenda, approve the minutes, and then you go into closed session. What type of matters are typically discussed in closed session for your board as well?
So same thing, closed session includes talking about disciplinary actions. That's the main thing.
Okay.
We do before we go into closed session, we have a whole meeting. So with minutes, we approve minutes, of course. We get the reports from the executive director, our attorney. We talk about a whole lot of stuff before we ever get to closed meeting.
Okay.
Yeah.
So in comparison to the other two boards you're at the table with, optometry is overseeing a relatively small licensure population in comparison. We have about 210 licensed optometrists. And then 230. Oh, maybe I got that number wrong. Hold on. Oh, no. 226.
At least.
226. How are you all seeing the profession in terms of demand? So there were some public witnesses who testified in terms of like it's harder or becoming harder to be able to find an optometrist, specifically one who is accepting Medicaid. Are there things that we should be doing in the district to better help bolster the workforce for your particular profession?
It's a good loaded question.
Sorry.
No, it's okay. It's okay. One thing, one of our barriers to attracting and retaining our optometrists in DC is their inability to practice to the fullest potential of their scope of practice because of the way the laws of the district are. So, for example, the main example is not allowing us to treat glaucoma without supervision from an ophthalmologist, or it says in the regs, or their physician. We are trained, the optometrists graduating today get full training with their therapeutic drugs and everything to treat. And we're not allowed to do that. We're allowed to do it in 46 other states in the United States, but not here in the district. So that's one problem. I think, did you mention also about finding optometrists or whoever to accept Medicaid?
Yes.
Yeah. So I think one problem there, or the problem there, is probably the reimbursement that they get. Because I think at this point, when I talk to patients, conversations, they can't find anybody who takes their insurance. It's very hard to find somebody who takes their insurance. And if you find someone, or if there is someone who takes their insurance, the wait time is ridiculous. So, that's hindering care.
Yeah.
Yeah.
Okay. I have that experience myself. Like if I don't go in 4 weeks before when I know I'm due, like it's going to be another couple of weeks after that before I'm able to get in and see my my optometrist. When you mentioned the situation about glaucoma, this was a thing I recall. Okay, it's now refreshed. Okay, we're not gonna open old scabs.
Thank you.
Uh, okay. Over the past year, in terms of complaints, what's the category and the type of complaints that you receive in optometry? If it's not around unlicensed practice, what are you normally getting?
Most of the times the complaints we get are more, I would say like the patient care or what they think they're supposed to get.
Okay.
And I'll leave it there because then it goes into more private stuff.
Okay.
Yeah. Okay.
All right. Ms. Nixon, and just in general in question, so I know that you all do the workforce survey every year in terms of DC Health. Have you all mapped where providers are in DC so that we have a better understanding of where the areas of deep shortage are?
So the workforce survey is conducted every 2 years based on the renewals. But yes, that is practice location is one of the questions asked so that individuals can provide that. So we are able to identify where people are working if they're working in the district. And that is some of the information that's provided in the workforce survey.
Okay. Is it possible for us to get the most updated workforce surveys for all three of the professions here?
Sure. The Board of Optometry will have
Yeah,
one.
because their
Yes.
renewal is coming up.
I think the Board of Pharmacy, their renewal just ended, and the Board of Dentistry is currently renewed. So it will not be the most recent, but we will send you the last one that was completed.
Okay. I think that would be helpful information, not just for the committee, but also for the Deputy Mayor for Planning and Economic Development, as well as the Office of Planning. We should know where providers are located. I have in theory where I think it's probably going to say, which is very similar to what it is for medicine. Everybody's popping in downtown, but maybe there are other areas where someone might say this is a priority focus area and we might want to, I don't know, there are a variety of different ways, whether it's us building out infrastructure and helping a provider be there, X, Y, Z. I'm not sure, but us to sort of think about it from that perspective. Okay. Is there anything that you all want to share with the committee that I didn't have an opportunity to ask? No, everybody's like, nope, nope, nope. I want to get out of the hot seat. Okay. I don't have any further questions for you all. Let's just take a really quick 5-minute break and then we'll come back and we'll do Food Policy Council. So thank you. Thank you so much. Oh, wait, before I do that, I'm supposed to do my PSA. Serving on a health board or policy, professional licensing board is an excellent way to give back to the District of Columbia as well as to your profession. If you are interested in serving on any of these boards or any of the other ones that we don't have before us today, please go to the Mayor's Office of Talent and Appointments and fill out an application. All right, we'll take a 5-minute break. Thank you. Okie dokie. We're back. Okay. We've been joined by Caroline Howe, who is the Food Policy Director at the DC Office of Planning and Food Policy Council. Caroline, when you're ready.
Wonderful. Good morning, Councilmember Henderson, members and staff of the committee. My name is Caroline Howe, and I am pleased to testify today regarding the performance of the Food Policy Council and the Office of Planning's Food Policy Team in fiscal year 25. 2025 has been a year of so much change for our district residents and for many district programs. In that context, I'm excited to share with you how we have navigated those challenges and communicated them with the public, as well as how we're building preparedness for the future. I'll also share the ways we've brought various communities together in the past year to build food access, our research outcomes, and our priorities for 2026. To start, we've worked hard to understand the impacts of federal changes on district residents and worked with peer agencies to communicate as one DC about changing food access landscape. During the federal government shutdown, we convened agencies to discuss real-time what we were hearing about benefits and discuss how to best communicate those changes to residents. This led to the Food Policy Council's website being used as the central place for resources from multiple agencies to refer clients to, including DHS's push notifications to all SNAP participants. Lifting up the potential impact of a SNAP shutdown on residents enabled Mayor Bowser to make the critical decision she did to fund district SNAP benefits in November of 2025, making DC the only jurisdiction in the US that was able to issue full SNAP benefits on time to all residents at that time. We convened emergency food providers regularly as the impacts of the shutdown loomed and then felt, and we shared both the solutions that community was coming up with and the impact with ANCs, as you heard earlier, and our Public Food Policy Council meetings and emergency food providers. We're also proactively working to prepare for future emergencies of any cause. And over the last year have continued work with Homeland Security and Emergency Management Agency to build plans for preparedness for food access, both with supply chains into the city and from distribution points to residents. We're now working with HCMA and all food procuring agencies to ensure our food contracts have continuity of operation plans and to ensure that we have reasonably priced emergency contracts in place in what we hope will not happen, but we know will, emergencies in the future. Convening this group is one of the benefits of our procurement community of practice, which we've convened since early 2025 and been able to expand this year with the added capacity of a grant-funded position focused on procurement on my team. The procurement community of practice, facilitated between my office and DOE's Green Food Team, has brought together all food procuring agencies to share their best practices and challenges. Together, the group has improved on taste testing methods, promoting plant-based menus, and provided essential feedback for our work analyzing the costs and benefits of central warehousing and central food processing facilities for the district. Relatedly, we also convened the agencies who hire food service staff with workforce development training providers to both update Make Food Work of the Food Policy Council's workforce strategy and also enable agencies, for example, DCPS, to connect with programs training chefs to fill our vacancies in food service that lower costs for labor by reducing the need for temporary staffing contracts. Our convenings continue to stretch beyond district agencies, and as always, we've convened partners focused on serving particularly vulnerable communities. In FY25, we focused on hunger in the LGBTQ community in DC, and with the Mayor's Office of LGBTQ Affairs, we brought together organizations that provide essential food and benefits access resource to LGBTQ community members. We were able to connect those organizations to both district funding and philanthropic programs, for example, to expand their refrigeration so they could offer more produce to residents. There's much more to do here. Expanding funding for programs that bring food to LGBTQ communities, expanding cultural competency for food access programs, and exploring more partnerships that can best expand food access in the LGBTQ community. I'm proud of the way we've continued to convene agencies and groups that don't often communicate. Our new Reducing Wasted Food Working Group, which you heard from Kate earlier, was able to connect the Department of Public Works Office of Waste Diversion with DC Health's ongoing training for food navigators and SNAP Ed partners to ensure that those providing food access to residents get those residents up-to-date information about food storage, reuse strategies, and date labeling so we can all make the most of food. This work has also been essential to bring agencies together to communicate to our food businesses. As you heard from Nina earlier about legislation implemented in 2025, the BEST Act, the Street Vendor Modernization Act, and changes to cottage food that make it easier and less costly to start a small food business. We also brought businesses, farmers market operators, and vendors together to ensure they knew their feedback had been heard in the development of the Farmers Market Support Amendment Act, which you know well, and that they knew how to testify at the hearings so you could hear their voices directly. This helped ensure that stakeholders knew grants were being developed, and when DC Health released those grants, stakeholders were prepared with relevant ideas and projects. We saw substantial interest even in that grant program's first year. These relationships continue to pay off with our team's ability to have stakeholder trust for direct communication, such as during the government shutdown, coordinating with farmers markets around benefits, and even last week in the snow emergency to ensure the snow team cleared essential roads for markets. The food policy team has contributed meaningfully to the work at OP, which you can hear more about at OP's Oversight tomorrow, but I particularly want to highlight our team's work on implementing OP's small area plans, so many of which highlight the need for food access. We're working in the FY26 Ward 7 implementation grants to build a shared commercial kitchen for Ward 7 based food businesses. Ward 7 and 8 have long been underserved with shared kitchen infrastructure, and we're thrilled to be a part of bringing a shared kitchen to Ward 7. The other major success that the Food Policy Council built on in 2025 is expanding the transparency of the district's budget on food spending and the impact of those programs. Beyond our annual food system assessment, we've created resources to make sure all residents are clear about how they can testify with all relevant agencies about food programs and about how budget is being allocated in the proposed and approved budgets each year. We ended 2025 with a presentation on the impacts of all district food programs in the past year, including updates from 15 agencies. And this also included a retrospective analysis of several programs whose guaranteed funding has ended or is ending, including the past 5 years of Nourish DC and the Food Access Fund, as well as the district's federally funded SNAP-Ed program. We're working to analyze census data of demographics with a real impact on food access. Families without access to a vehicle, seniors living alone, households under 200% of the federal poverty line, and more. And we're layering that onto transit access maps that allow us to look at specific blocks where residents can't access a grocery store in 20 minutes of walking or public transit. By exploring not just geographic, but physical access along with economic access, we're working to develop more nuanced food priority areas that can inform our sister agency efforts to shape specific interventions, such as investment needed for grocery stores, or in DC Health's online delivery pilot, which you also know well, prioritized outreach to onboard members beginning with priority neighborhoods where both vehicle access and grocery access were leased. We've conducted a lot of research projects with university partners, some of whom you've heard from today. So a quick highlight, we worked with GW's Redstone Center and our Sustainable Supply Chain Working Group to release a detailed analysis of food procurement in the district. We're also working with Professor Gabby Hendrick at GW on a study regarding dignified food access and completed research on the intersection between urban agriculture and affordable housing. With AU, we're developing a data dashboard that will allow us to report on the district's food program throughout the year as soon as data is released and over multiple years. We worked with Georgetown, looking at the asset-limited, income-constrained, and employed population, residents who earn too much to receive benefits but too little to manage those costs of increasing rent, medical care, and food. Programs that require no proof of income are seeing increased demand, and the district needs to adjust to this increasing need in this population. We've accomplished a lot in 2025 amidst huge changes to the food system, several vacancies across district government that serve food access, and several vacancies on the Food Policy Council. I'm proud of the hard work of my dedicated team to fill those gaps and the passionate members of the Food Policy Council, both our appointed members and our active ex officios. In 2026, I'm optimistic that we'll be able to fill those vacancies and work towards our very ambitious priorities for 2026. We've built out priorities that emphasize our commitment to transparency and data sharing, with all working groups committed to getting information out to residents about existing programs and building more cross-sectoral relationships. We're committed to developing a food retail strategy that can incorporate existing initiatives, best practices from our peers, and community input that addresses geographic, physical, economic, and educational access in healthy food priority areas. We're committed to mitigating the impacts of these changes to SNAP and to SNAP-Ed. evaluating what's needed amidst these federal changes, and ensuring that the district and our philanthropic partners invest strategically in what is needed now. Since 2015, the Food Policy Council has been ensuring that great food policy is passed in the district. We have ambitious goals on paper around urban agriculture, food waste diversion, supporting food businesses, and expanding healthy food access. We remain dedicated to ensuring the district implements what we've committed to and that we continue to build a healthy, equitable, sustainable food system for all. It's my honor to serve as Food Policy Director and to be here testifying before you today. Thank you for your time, and I'd be glad to take any questions.
Thank you. Okay. For all of these questions, you can blame Ona. All right, let's start with some staff. So the Food Policy Office within Office of Planning has 4.3 FTEs, including 1 vacancy. What's the vacant position meant to work on?
The vacancy, our food policy analysts split the work of the team. So the grant funded position, a little bit uniquely, is focused on sustainable supply chain work because it was funded by the Resilient Food System Infrastructure Grants. But across myself and our food policy analysts, we split the work of the council. If we were to fill that vacancy, we would be able to focus more holistically on addressing the SNAP changes that are coming, to really be looking at food as medicine in the changing landscape that we have, and to really be doing engagement. Multiple years ago, council did fund us to have an engagement position, which has never been funded. The capacity on engagement has been decreased year after year. And I think that is such, as you heard from testimony earlier, such an essential part of what we do. And with more staff capacity, we would be able to attend more meetings, be able to share more about what's going on in the district in community spaces.
Okay. The FTE that's funded via the USDA Resilient Food System Infrastructure Grant, do we foresee USDA extending this funding?
No.
So you already know it's going to end March of 27?
Correct.
Okay. Okay. In the same vein as the boards we talked about before, so you all have some vacancies. You have currently 8 active members, 3 vacancies. Have you all proposed some new members to the Mayor's Office of Talent and Appointments?
As I understand it, we, as you heard from other boards earlier, end each of our meetings with a reminder that people can apply. We have had lots of people who have applied. I have not received any of those applications from the Mayor's Office of Talent and Affairs, although I know they have submitted them.
Okay.
So we've had several transitions through our point of contact at MODA in the past year. And so I'll also say that our vacancies, we're really adamant about increasing accountability to members who have not been active.
Yeah.
And so I think our goal was to be able to increase that accountability and then replace them quickly, and that has not been able to happen. So I'm optimistic that we will be able to fill those.
Okay. I think that's important. I mean, we have some board members who, on some other boards, where they've missed more than half the meetings. And in that case, you're not even knowledgeable on what's happening. And also you're perhaps holding a seat that could be better utilized by someone who has more time to give to be a full active participant in the meetings.
Absolutely. I think that's also what, in holding that account, you do need to be able to refill it with someone who could be active.
Yeah.
And we're really hoping to be able to do that.
Okay. Okay. So the original statute creating the Food Policy Council placed the Food Policy Director within the Office of Planning, based on a model from a few other cities. Now that we've kind of been in this for a little bit of time, are there some challenges that arise from you all sort of being situated there as opposed to maybe at another agency like DC Health that actively works on food and food infrastructure?
Yeah, I mean, there have been incredible things about being within the Office of Planning, and I do think we've been able to integrate ourselves, as I mentioned, into so many of our small area plans and strategic plans for the district. I do think that many of our peers, Food Policy Council, are able to do more around implementation than we are able to, because implementation is not the mission of the Office of Planning. So I think that is a reality. We do work very closely with DC Health and with many different parts of DC Health. And I think that it would very much depend on the direction that council sees in the future shape of the Food Policy Council. I remain really excited about being able to work across agencies, and I think that's my priority for wherever the Food Policy Council were to be, to enable us to continue to work across committees in terms of seeing legislation move forward, as well as being able to both be in a planning and in an implementation.
Okay. Let's talk about food procurement and some school meals. We'll discuss further on the thing that we just talked about. I don't want to make it awkward. I like OP.
As do I, and I have loved the support of the Office of Planning.
Yes, yes. Okay. In the pre-hearing responses, you all described Food Policy Council's collaboration with the Office of the City Administrator to better understand some potential cost savings around centralized food processing facility. And interestingly, a finding that it could save about $25 million annually in terms of meal costs. Can you provide a little bit more detail on the type of analysis that you all did? And can we get a copy?
So I'd be happy to share a little bit more about what we did. To begin with, I'm really excited that we both simultaneously have been working on this study, as well as really beginning to implement it through shared warehousing. So the Office of the City Administrator identified an OCP warehouse that has been, space has been cleared for food products to be stored. Kate mentioned earlier, our aluminum pans are already there that DCPS is drawing down to be able to enable at no cost to the district food rescue and food distribution. The goal being that we're building the systems, the infrastructure, the actual online ordering capacity to get us towards central food processing in the future. The study itself, the way that we conducted the analysis, as you recall, council funded us 2 years ago to do a really deep dive into possibilities for the central food processing facility.
Yeah.
So it scoped out in that a lot of what we would need, the type of space, the type of infrastructure. And so we really doubled down on that to be looking very specifically at the costs of that kind of equipment. DGS provided some locations and potential operating costs and the reconstruction needed to transfer them from those spaces to a central food processing facility. We also looked at things like delivery vehicles that would be needed and equipment potentially needed at peer processing facilities and at facilities like DC Central Kitchens and in existing DCPS schools. And then we looked at all of the meals that are currently being produced and served in the district, both through district contracts and through our self-operating facilities, and looked at the potential cost that is currently happening within our existing contracts and our self-operating facilities, as well as our the contracts that we have. Councilmember Fruman, you're just in time. We're talking about the central food processing facility analysis. So we looked at those construction costs, the equipment costs, the labor costs, and estimated food costs in order to build this, what a central food processing facility would cost to operate, compared to what we're currently spending, and then looking at both with estimated increases in costs over time, and in order to be able to compare annual savings in these two models. So I'm really pleased with the analysis that we've done, and
So when do we get a copy of said analysis?
That is a wonderful question that I will be sure to work with the Office of the City Administrator.
Oh my gosh. So we paid for a study. You did it, but you can't give it to us.
The study that we did is public around those other pieces. This work, I would be happy to share more with you by the time of the Procurement Act hearing.
Okay.
And I will share with you what I can at that time.
Okay. All right. That's fair. We've been joined by Councilmember Matt Freeman from Ward 3, who's a member of the committee. Councilmember Freeman, I'm just going to finish up a couple of questions and then I'll turn to you. Okay. So you mentioned that you guys are working on the warehouse pilot to test the centralized storage and the joint purchasing. What meal programs would be involved in that?
So in currently looking at this shared storage, we're working with DCPS's self-operated facilities, the
Okay.
Department of Youth Rehabilitation Services, and our hope is to be able to onboard the Department of Behavioral Health as well. Those are the three essentially self-operated meal programs
Yeah.
where the district actually has staff is purchasing food and is making food on site.
Okay. When
So it'll be
you
all
say
their
Department
supplies.
of Behavioral Health, do you mean St. Elizabeth's Hospital?
Yes.
Great. I'll just leave it there at that. All right. So your office leads a monthly community of practice with district agencies that procure meals. So schools, rec centers, DC jail, DRS. What has come up as sort of a big challenge in terms of improving food procurement?
I mean, I think one thing that has been so wonderful in a challenge we've been able to address through just bringing the community of practice together is really ensuring that we're incorporating best practice language and that we're doing this training across all agencies. So for example, the district implemented the environmentally preferable products and services standard this year, rolling out including food standards. And each agency had a lot of similar questions, and being able to hear each other's questions meant that we're able to really think about what impact is this going to have on our contract? How is that going to impact cost? And how is OCP going to navigate that? And addressing that simultaneously, I think, was a real challenge in the past that just by bringing people together, we've been able to achieve. That said, I think that a lack of clarity around how these decisions are going to influence cost and whether or not the district is prepared to absorb them, I think is something that remains one of the biggest challenges around procurement. Now, not all of these procurement changes require any additional cost. When we look at the ways in which some agencies have shifted from the lessons that DPR has had in doing plant-based chicken nuggets and chicken nuggets, taste tests, can students tell the difference? No. So what does it look like for us to think about cost comparable options to be investing in more plant-based options? And I think those kinds of, that there can be a lot of fear and concern about uptake in switching products, and being able to share those across agencies is really powerful. But I do think on cost, when we think about, even as DOC is developing their new scope of work right now for the next contract for the DC jail, there are many things that were included in Secure DC that were not funded, but that are still recommendations that DOC is seeking to follow to the best extent that they can, but that could require additional investment, and that in the very tight budget environment that we're in, feel very complicated for agencies to know how to proceed.
Yeah. Okay. My final question is around universal free school meals.
Yes.
Which I feel like is a train we have been on for 4 years now of trying to accomplish. But in your role of representing the district, when you go to these national conferences and commissions, how's it going in other jurisdictions who've been able to accomplish this where we have not?
I think that in many places that have passed and have successfully implemented universal school meals, they've been able to really make the case that this is changing health outcomes. And when we think about the costs, especially in a place like the district, as we consider bearing more of the cost of Medicaid, what does it look like for us to really be addressing at source some of these challenges and ensuring that our kids are getting food, and that all kids are getting meals? I think that's one reason that we also see all of this as interconnected and have loved having someone focused on procurement as well as our ongoing work on food access. This idea that if we're lowering the cost of what it takes to produce a meal, can we change the economics on universal school meals? Because a few cents on the meal when we're serving 20 million a year makes quite a big difference.
Yeah.
And so I think that that's one of the other pieces that I've seen in some peer jurisdictions that have been able to successfully implement universal school meals.
Okay. Councilmember Furman.
Thank you very much. And Ms. Howe, you're totally right. My first question was going to be, I'm not even going to ask a question. I'll let you answer. And on my way down, I heard Councilmember Henderson talking about the Central Food Processing Facility dynamics, and I thought, should I turn around? But I'm here. Talk to me a little bit about where we are on that. I understand that there is the one warehouse that is kind of the tip of the project. But in terms of going more broadly, where are we in the planning for that?
Well, I think, again, the community of practice has been really beneficial to get all of these agencies on the same page. We did that a bit with our study 2 years ago, really bringing agencies together to be able to talk about what it would mean to have a central food processing facility. And I think there are some very reasonable concerns and hesitancies about it's a lot of change. And so I think that that is a big piece of progress of being able to let people know that this is a transition and this is something that will be a multi-year transition if the district decides to invest in a central food processing facility. I think some really big progress about being able to have OCA involved in really looking at this and having, again, our staff capacity to do a lot of cost benefit analysis, really digging into the numbers, is the idea of really, we've been able to actually get lists of sites from DGS that are potentials for a central food processing facility and really think about whether it is those sites that the district already owns or others that we consider. We're really able to get more into the brass tacks about what it would cost to renovate a building and actually build it. So I think that's significant progress. I think we've also been able to really think through some of the different scenarios. Again, that consultant report really looked at the possibility of having multiple central food processing facilities, in part because we hadn't been able to find any sites from DGS that would be large enough. Now it does look like there could be some sites large enough. And I also think the district is in the midst of many large-scale development projects that could be really interesting to think about whether or not a central food processing facility could be an anchor at Capitol Gateway as we build out a grocery store and other needed amenities in that site. But in the meantime, I think that we've been able to really drill down into what different agencies would need in terms of preparing meal components, in terms of preparing whole, fully prepared meals for the agencies that need them. And I think really looking at the transition to having all meals in the district be self-operated. It would be such a substantial change from our existing vended out model.
Yeah, and on the conversation about universal free school meals and cost, self-operated, how does the cost of our self-operated today compare to our vended?
That is a great question. And I think the current scale of our self-operated meals is so small, at least in terms of DCPS, is quite small compared to the other, our vended meals. I think that there's really quite a range because when you look at self-operated DYRS, St. Elizabeth's, and the 6 DCPS schools, even within that, there's quite a range, but I wouldn't say that it is on average substantially higher. When we've looked at scaling that up, our average meal cost across all meal programs currently is $5.08. That's across all district meals. Our estimates for self-operated would be $4.35. So substantially less. I can get you in terms of if you're asking like what are the current costs today, I'd be happy to follow you up.
No, I think you answered my question and you gave me the answer that I was hoping for. Because there is also the benefit if we had a central food processing facility or a number of them, then our investment in that would be an investment in us as opposed to an investment in the infrastructure owned by a private entity. So there's that kind of savings. And if we could get to universal free school meals, I know I'm preaching to the choir, there are other savings like what you're talking about in the health space. So I want to get there.
Some of the other costs that I think we are not going to be able to quantify, I touched on healthcare costs, but also by bringing more employment into the district with central food processing as opposed to all of the processing that is happening out of the district, we're creating employment, we're generating income tax here for the district, and we also have the opportunity to be employing our hardest to employ residents. I touched on that in our workforce piece around how we've been working with workforce training providers in the district and our district agencies. So many of our workforce training providers focus on returning citizens, for example, who cannot be employed at DYRS, at DBH, or at DCPS. And so we're training these people for jobs that cannot enter into these district government agencies. If we had a central food processing facility, we would be able to employ those residents regardless of their background because they wouldn't be directly interacting with the students at DCPS or the other residents at the DC jail or DYRS.
All right. Well, all great. I mean, part of the reason that I wanted to come here is to be on the record urging that we move in this direction so that it is that there's as broad of a group of people supporting going in this direction as possible. And I want to be part of that choir. One of the things you talked about was the upcoming contract for the Department of Corrections. And
Yes.
people have reached out to me about the Department of Corrections, not satisfied with the meals that are delivered there now. What does this procurement process look like? And is there an acknowledgement, or is there that the meals should be better than they are today?
I think there's certainly an acknowledgement that there are challenges with the meals currently being served and opportunities to improve them. I think what we've been working on is really integrating language that's already been used in other district contracts. So, for example, DCPS and DPR have both removed many additives, dyes, and preservatives, which would mean that things like bologna, which is sort of one of the center points in a lot of the residents' complaint about food at the jail, their bologna sandwiches, would be required for the vendor to no longer be serving that kind of processed and preserved meats. So there's some ways with minimal cost increases and minimal other changes that we could be seeing that kind of improvement. And those are the kinds of things we're hoping to make immediate change. Of course, Secure DC went a lot farther in terms of the requirements it put on DOC, all of which would require additional cost. We're currently paying, correct me if I'm wrong, but just over $2 a meal for what's being served at DOC.
That's what I was told also.
And so-
208, if I'm remembering correctly.
And so I do think that there's a reality that when the costs are so low, there are still improvements that can be made at that cost, but that is something that the district would have to commit to and put some more requirements on. I think the other piece within the existing contract, and that I think there's other conversations unfolding around the fact that if we are able to improve quality of the food served, can we also reduce the waste that is currently happening in all of our district agencies, but at DOC particularly. So by looking at what is being thrown away and improving those menus specifically, we can actually close this gap between sustainability, waste, and food quality. I think there's also really interesting conversations about the fact that more and more residents are requesting alternate meals at DOC, and that could very well be that there are more people with religious preferences at DOC. It is also indicative of the quality that people are receiving in different types of meals. So again, by increasing quality, we might actually be able to reduce our costs in some ways by encouraging people to have the meals that are being served and prepared at DOC.
Thank you. So what I'm hearing is we're preparing the RFP for DOC right now, and it will go out at some point soon?
Exactly. And so I do think that there is an opportunity, should council want to influence that at this moment. But the RFP will be going out soon, and then that would be the next 5-year contract for DOC.
Okay, pivoting.
Yeah.
In terms of when's the next RFP go out for DCPS? Because I think there's an interplay to the Central Food Processing Facility conversation about and what kinds of preparation is happening to get ready for that?
Great question.
Okay, Caroline, you're gonna have to relay that.
I will. So the milk and produce contracts are currently up for those self-operated schools. But then the actual meal contracts are in. Yeah, they're all. Do you want to bring in option?
Do you want to come to the table, introduce yourself? We like to phone a friend. It's okay.
Right. And I will say this is one of the incredible things about the fact that Kashef was able to join our team and has built a contracts dashboard so that it is possible to immediately have that information available.
If you could just introduce yourself for the record. It's on.
It's on.
Yeah.
Okay. Hi, everyone. My name is Kashef Momin. I'm a food policy analyst on the food policy team, and I'm the position that is funded by the RFSI grant. And so in terms of our contracts, DCPS's contracts with Airmark, Sodexo, and DC Central Kitchen, they're all in their second option year. And so those would be renewed or up for renewal in 2 years.
Oh, that's sooner than I thought. Okay. All right. Puts a little fire under us, doesn't it?
I do think that it is also, while the district has operated essentially with contracts, all of these contracts are issued as a single year with multiple year extensions, all of which have been taken. There is an opportunity for the district to think about a more intermediate contract.
Okay, last thing. I know I'm over, but it is my last question. I visited Letter Farms and the Oxon Hill. I forget the name of the farm there, but I mean, sensational facilities. I'm curious, do you have ambitions to have more of those kinds of facilities in other places? And if so, can you speak to it?
Yeah, I'm so thrilled that you brought up Letterer. One of the things that I'm most proud of that didn't make it in here is the fact that we just found out that despite all of the challenges with the federal government, the Federal Community Projects Fund did issue $850,000 to Letterer to begin the design process for the renovation of that environmental education center, which has been the top request of DPR for their capital investments for the last 2 years. And I'm really hoping that this year we're able to complete the design with that federal funding and move into construction. They are rebuilding the greenhouse at Letterer this year with local funds. In terms of, I'm thrilled with the work DPR has done, and Oxon, the well at Oxon Run is an incredible example of really leveraging the intention of our land lease programs, which was designed to lease land from district properties, DPR and DGS, to farms and gardens. And that's something I'm thrilled. We have our new lead in the Office of Urban Ag who started on Monday. That position's been vacant for just over 9 months. And I'm thrilled to be able to have someone really focused on how do we ensure that DGS is moving forward with that land lease program, and how do we continue to support and invest in DPR and DPR's partner gardens. DPR's partner gardens include Letterer, Kelly Miller, Fort DuPont, several other facilities. And I'm very excited that through the Urban Ag Working Group this year, in the absence of an Urban Ag Director, we've really brought those agencies together to have some really important conversations about how we move those projects forward.
All right, and thank you very much, and thank you for letting me run long.
No, it's okay. This is very informative and delightful, especially for those of us who like food. Caroline, can you speak a little bit more about this contracts database? How expansive is it?
So it looks just at the food contracts in the district.
Okay.
And Kashaf, would you like to share anything else about what's in there?
Sure, it's sort of in its early stages, but we're tracking all food contracts that are associated with meal programs in the district to really understand when they're up for renewal, and also what stipulations are in those contracts, to be able to know how we can come in and provide support to those agencies to be able to incorporate more values-based language in those contracts, or language around food management and food operations for emergency planning. So we're really just assessing all of those contracts and being able to know when they're up for renewal, which year they're in, so that we can contribute as when the time is right.
No, I think that's good, because I feel like oftentimes, at least by the time it gets to us, it's either like, hey, you got to do this now. You can't make any changes. There's no conversation. But no one ever knew that there was an opportunity, 6 to 8, 9 months prior. Okay, hey, this is coming up for renewal before it goes out for RFP. Are there any changes that we want to see that could help better move us in the right direction?
And I would just add that at the same time, I'm also really collecting all best practice language across all of the food values, from nutrition to sustainability and to animal welfare and valued workforce, to really have a more comprehensive recommendations when we go to the solicitation and contract process. So how can we incorporate really strong language, both in the RFP process, but then also in the contracts? And so developing that and having that as a resource readily available for agencies will, I think, be tremendously helpful.
Yeah. I also think in the general scheme of things, when we're sort of talking about some of these meals, whether it be DCPS or DOC or DRS or even I think DACL does some meals as well. When folks are often talking about the quality and I have to remind them of like how much we pay per meal. It's like, and they're like, oh, I'm like, yeah. When you said DOC was at a little bit over $2 a meal, that's higher than it was. It used to be the lowest. I mean, is still the lowest. But it used to be like $1 and some change that someone would have to put together a meal. So that's how you often get meals that consist of a bologna sandwich and a piece of fruit. And we call that nutritious. And, I'm of the belief that even if you're incarcerated, you still need to eat. And it's our responsibility to ensure that you're not just eating a sandwich each and every day. All right. I want to ask some questions about SNAP and food security. So as you know, that Congress canceled all of the SNAP Ed programs in HR 1. What impact have you seen in the district nutrition programs following that?
Yeah, that's one of the things that I've been really grateful to be able to focus on and that we will have in our food system assessment, which I have before me, but is going through IQ, and I can't wait to be able to get to you. But in
Such a tease.
I know, I'm sorry. But there were, so when SNAP Ed was cut, DC Health was able to provide local funding through December 31st, but it did mean that, last year, those SNAP Ed dollars funded 279 classes across the district, which includes month-long, 6-week-long culinary cooking classes for thousands of district residents. The other program that's being cut because of these SNAP Ed cuts is YMCA's Veggie Butcher program, which I love to hype. They sent nutritionists and food prep people with ServSafe certifications to farmers markets to actually be doing processing for people. So you might buy a butternut squash but not have the knives to cut it at home. Their veggie butchers were prepping it on site, free of cost. So people were going home with spiralized zucchini ready to turn into zoodles and butternut squash cooked and ready to go into a soup. It made produce so much more accessible while also teaching people how to prepare these foods. That program was an incredible investment of those federal dollars to our local programs. SNAP Ed also funded quite a number of food print sites. Of course, there's a lot of local funding for food prints as well. Food prints reaches 7,600 children every year, but a significant amount of that money did come from SNAP Ed dollars. And then, oh yeah, sorry.
Sorry, on that in particular, it would be helpful to know before we get to the budget process how many food print sites were funded out of SNAP Ed. That's often one of the ones that food prints is incredibly popular
Yes.
in our schools. And if some school is going to lose their site due to loss of federal funding, we would like to know that.
Absolutely. I'd be happy to follow up with you about that. And also in my conversations with Fresh Farm, I know that their focus has been shifting around where local dollars are being spent because so many of the SNAP Ed schools, SNAP Ed funding was going to fund our schools in Ward 7 and 8. And so ensuring that we are not just losing those food print programs in those schools.
Yeah.
But I will follow up with both the SNAP Ed team and Fresh Farm and get back to you.
Great. Also, the Veggie Butcher program, I wish I had known.
I love it.
I will. That's a game changer, right? If you think about it from the perspective of, well, I'm a more of a social coffee drinker, but for the people who drink coffee at home, you buy your coffee beans and, you go to the grocery store and I think they grind. Yes, grind it for you. The idea that some people were choosing not to explore certain vegetables because they didn't have the tools by which to properly prepare them. This is like what a service.
It's incredible. I will say when I was at UDC, we had students providing that service at UDC's farmers markets. It's an incredible program. And I also think it's something that really does have the opportunity to scale what people consider eating.
Okay. All right. So for the last 11 years, the district has provided some additional local dollars to raise the floor for monthly STAT benefits. We're at $30 a month. What concerns do you have about this amount staying stagnant?
I mean, the costs of food are going up rapidly in the district. And I think that all of the surveys, both what we are doing, what our partners at the Capital Area Food Bank did in their hunger report, really looking at the financial challenges that people are facing, the fact that both federally and locally our SNAP dollars are when they are not going up year over year while food costs are, we face a real challenge with residents. I'll also say, of course, SNAP is facing many challenges in the district right now, but I think that many of the residents that I've spoken with who have said, you know, $30 is quite different than the minimum of 17. The difference of, is it worth it, me providing all of my personal information to the government in exchange for X amount? $30 can make a difference in the food you're able to buy every month, but the amount you're able to purchase does go down every year with that amount.
Yeah, I mean, that's the like, what is the purchasing power in terms of $30? Even when I go to the grocery store, I'm like, I had only 5 things. And then I'm like
Correct.
thinking in my head, like, what did that cost? And, you know, sort of putting those pieces together. Work requirements are certainly going to come into effect. And I could definitely see a situation where someone who is receiving the minimum and then also the work requirements, they're just like, yeah, no, okay.
Correct. And I do think I'm really grateful for, in part, the work that we did in COVID under ONA, but also during this current shutdown, bringing together our partnership with DHS. I feel so much more in sync in making sure that we are clearly communicating to people what those work requirements are going to be and going to include, and really expanding the programs that already do exist in terms of SNAP employment and training and our workfare programs to ensure that residents have other ways to meet it, because it's a really challenging employment environment out there.
Yeah.
So the idea of having new work requirements, but the difficulties of getting a job, what are the other way that we're getting people into workforce development and that kind of training program?
Are you in part of those conversations?
Yes.
Okay, that's good to know. Are we prepared?
We are getting prepared.
You're so diplomatic.
But I do think I'll also say that that is one reason we were very excited about having a incredible SNAP expert as the person we were set to hire with our vacancy. And I do think that having more of that expertise on our team would enable us to be able to be an even more central part of those conversations.
Okay. So your office has been involved in the implementation of Sunbucks.
Yes.
How many children were able to benefit from this in 2025?
I will have to get back to you on that. In our role this year, we transitioned in 2025 from the central role we were playing in 2024 to really just being supporting on outreach and engagement.
So who was the agency that was central?
DHS is now really the lead agency. OSSI has been supporting with data, and DC Health this year supported with the call center, and we're the primary grant administrator for outreach grants.
Okay. The Urban Agriculture Working Group finalized a case study on how urban agriculture can be integrated into public housing.
Yeah.
In fiscal year 25. Can we get a copy of that?
Absolutely. I would love to share it with you. It's on our website, and I'll send it to you after this meeting.
Okay. Just high level, have you guys had conversations with DC Housing Authority about the findings?
I've had some conversations with them, and I do think that as some new projects come online, our ability to integrate them will be really exciting. I think I'm even more grateful for the conversations I've been able to have with the team at OP in really thinking about how do we integrate ag as one of those, whether it is rooftop ag or even ag on a ground floor. How do we recognize that agriculture is a community amenity and should be recognized as such when we're evaluating floor area ratios and other things that are key for developers? I'm also really excited, again, with new staffing at DOEE, fully staffed will be really exciting, but being able to connect more folks to the tax abatement, which this year did reach its cap, but we really promoted to affordable housing developers through the study and the follow-up of it, the fact that this is an option for them to reduce their property tax by investing in any scale of agriculture on their property.
Okay. You mentioned in your testimony about the Farmers Market Improvement Amendment Act, which we passed.
Thank you for your support.
We funded. And thank you for FPC collaborating with us on that legislation, because certainly based on the feedback of what you guys had received, I think that's how we got to where we saw where some of the kinks were and issues and challenges that needed to be addressed. How involved are you guys in terms of the implementation?
We're very actively involved. We had 2 or 3 members of my team as evaluators for
Oh,
the
okay.
grant.
Great.
I'm very excited about this year's grantees. As I mentioned, I think it was great to see how many people applied this year. I think we'll see even more robust applications next year. But I think the part that I am most excited about supporting as farmers market focus moves to DC Health, which has been within the Food Policy Council for some time. It's been incredible to make connections between, as DC Health got staffed up with those positions who are now focused on farmers markets, making sure they have the right connections at DC Health, DLCP, DDOT, others, and really supporting them as they build those connections. I referenced what happened during the snow emergency, and those were just connections DC Health didn't have yet, but being able to still be a part of the conversation that whenever they hit those roadblocks, they can still reach out to us. And I am very excited to be able to see DLCP has announced building this DC bridge, which is one central place for all business licensing, which I think will address both our farmers market challenges, our vending challenges, and a number of other pieces.
Yeah. Speaking of the businesses piece, I got like kudos. The woman who testified from the cottage food,
Nina, yeah.
Yeah, Nina. She had high praise for you all. And I think that I appreciate how the Food Policy Council has been sort of exercising to the full extent of your scope. And
Yes.
to borrow from the licensees from earlier, right? They want to practice to the full extent. And I think helping cottage food industry is not, I don't think it's outlined, subscribed in the statute as it relates to the Food Policy Council, but she clearly said that, but for your information, she wouldn't have known. And so you're certainly providing a service.
Thank you. I appreciate that. And I do think that that's a service, as you said, not outlined in the legislation, but as I see it, the legislation does ask us to be continuously evaluating whether or not the district is putting unnecessary barriers on our food businesses and how we should be supporting food businesses. And I take that incredibly seriously as a former cottage food business myself, not here in the district, but it's really, and working with 2 of our members on our Food Policy Council were cottage food businesses before they became now brick and mortar businesses of their own, in ways that I see it as a, and all of our other small business opportunities, the shared kitchen work we're doing, the work with vendors to ensure that they know where they can get licensed and how to get licensed. And you touched on this earlier, this question of legislation passes, how are we ensuring that agencies are implementing it? And I do think that that for me is a part of when we talk about a Food Policy Council, it is the full cycle of policy of ensuring that we're evaluating how it's being implemented.
Great. On sort of cottage food, street vendor modernization. So in that legislation, we created the micro enterprise kitchen, home kitchen certification within DC Health. Last budget season, there was only maybe 1 or 2 businesses that had actually gone through the process. And I know that I think we have DC Health before us next week, so we can certainly ask them some more questions about this. But what are you hearing, or are you hearing some feedback from vendors about some of the challenges still?
I look forward to their answers in terms of how many businesses are registered, and I certainly won't speak to that. In terms of what we've heard from businesses, I think the work of developing DC Bridge or whatever shape it takes for DLCP to be letting vendors know how and what they need from DLCP, what they need from DC Health, and in what order. You heard that loud and clear from farmers market operators. That's the same thing I hear from food vendors. And there's just still confusion as to what is needed first and what is needed later. The micro enterprise home kitchen is incredible. And I'm so grateful for the team at DC Health for so clearly communicating those changes. They've been really eager to participate in the trainings that we've held about that. I think there's still a lot more room for opportunity in terms of reaching all of the food businesses, both in the target area of the Vendor Modernization Act, that Columbia Heights Mount Pleasant corridor, but also our street vendors in Ward 7 and 8. We were having a discussion about this both with DLCP and OP with regards to the future of Poplar Point, and this idea of, is street vending only something that in Columbia Heights and Mount Pleasant thrives because of the Latina culture that exists there and a culture of street vending? I don't think that Ward 7 and 8 have ever had the opportunity to have sites to street vend. We don't have sidewalks. We don't have as many publicly really accessible and active parks, and we haven't had this licensing. And I don't know that the micro enterprise home kitchen and vending zone clarity has yet made it to all of our businesses. And that remains a commitment of mine for the coming year, and why we're also hoping to have more clear roadmaps. You heard also that from Nina earlier today, but the importance of that and being able, what I see as our role to, as well as DLCPs and DC Healths, to get that to aspiring entrepreneurs and existing food businesses in Ward 7 and 8, as well as areas that right now are hotbeds of vending.
Yeah. So vending is part of it. Obviously, we heard some testimony about grocery stores, and I'm gonna do my best to get to the DEMPED hearing.
Great.
Because it feels as though they've done some shifts, but Ona and I've been to the Marionberry Avenue Market, and they have an excellent combination of, you can get the staples that you need.
Yes.
And also fresh produce.
Yep.
And also prepared foods. It's all sort of in one location. And I'm just starting to think about whether or not small format stores such as that should be more of our strategy as opposed to big box grocery.
I think that's one reason why, I touched on one of our priorities for our team in 2026 is very much having more of those conversations with neighborhoods as part of the comp plan process, but also as part of developing a retail strategy. There are some shifts to the supermarket tax incentive program to enable more small businesses to, like small format stores, to take advantage of it. But I think there's other changes. We need the food access fund. We've used all of those funds, and Nourish DC, it's the final year. And I do think that the Marionberry Market is an example of, I will need to follow up with you on the amount, but it was certainly over $1 million that the district invested in that site. Atlanta has gotten a lot of publicity for its municipal grocery stores.
Yeah.
They're investing $8 million over the next 2 years. I think that, like, the scale of investment, and it is a small format store, the similar size to Marionberry. And so I do think we need to think strategically about how we're investing those dollars, and how we're investing those in both some critical geographic areas that can best serve the most number of people by walking and transit, when we're investing potentially what grocers are asking for, both to me and to my colleagues at DEMPED, is sometimes an investment of $12 million in order to be able to open. And so when we're looking at that kind of, I'm not suggesting that the district, I'm not suggesting that for the district, but I am suggesting that we think about, if our choice is between investing $12 million in one large format store or $12 million in 12 scale stores at the scale of Marionberry Market, how can we best be serving our neighborhoods? And how do we also shift how neighborhoods are thinking about shopping as we do that? So people are going to those markets. I think a big thing that Marionberry also was able to achieve is that it is not just food. You can also get your toilet paper, your aluminum foil, and things that you need in
That's
your.
what I'm saying, sort of like the staple of, oh, hey, rundown. I mean, there
Absolutely.
are other cities for whom, like in New York, right? The bodega sort of culture and network where, yes, you have grocery stores, but also you're not going to a grocery store every day, or you may not even be going to a grocery store every week. You might just be going to the grocery store once, and then your corner store is your sort of maintenance, right? Like, oh shoot, we ran out of cereal. Let me just run down to the corner real quick and get some more, or something to that effect. What we've learned though in conversations with like DC Central Kitchen and otherwise, it's an investment for a store to build out the infrastructure, to even have the refrigerators necessary to be able to offer those things. And we've been able to sort of plug it in. But once we do that, then are we doing a feedback loop with community to let them know that these are options and places where they can go, with consistent and predictable hours and doing those kinds of things. I have to say though, I feel like I would love to see in the next year some more synergy between the Food Policy Council and the work of DENPED in some of these conversations around food retail recruitment. No shade to the DENPED folks, but like I feel like you could sell a neighborhood. You, Caroline, can sell a neighborhood in terms of what is the potential of a particular site location in ways that a retailer might not be thinking of, and perhaps in some ways we aren't necessarily even focusing on as well. Like, I think given the unique, not that we want to ever base it on alcohol, but like given the unique alcohol laws of Maryland, DC, and Virginia, I think that actually positions DC for some very unique, putting some grocery stores on the border where folks are willing to come over for whatever that might be. And for whatever reason, we haven't just been able to sort of crack that. Like, I feel like Rhode Island Avenue, that area, Fort Lincoln is ripe.
Absolutely.
Certainly with population, but also geographic location to be able to pull some folks across to be able to serve those areas. But maybe we're not marketing it right.
I think that that's a really interesting point. We've been so focused on reducing the drain of district shoppers to Maryland and Virginia without necessarily how are we enticing. And I do think we're going to have to be creative. When I think about how many plans the Office of Planning has put forward that and commitments the district has made to different properties and sites to bring a grocery store that we have not yet come through on, that for me is really a fire for us to think we have to get more creative about what incentives we're offering grocery stores, because we don't have $12 million for every grocery store. Correct. So what are the creative ways we're thinking about? And I think as we're working on the master plan for Poplar Point, really thinking, well, we have to be leaning into density bonuses. How are we also thinking about the ways in which we are in places where it is appropriate for the district to be building densely around an anchor of a grocery store that is providing guaranteed demand, but also then being able to serve, in the case of Poplar Point, really key areas of Ward 8 that really need a grocery store.
Yeah. Okay. Is there anything I haven't asked you that you wanted to share with the committee?
I think that we have covered so much today. I'm grateful for all of your questions, and I will be sure to follow up on these with you afterwards.
Awesome. All right. Well, I think that wraps us up for today. I want to thank the public witnesses who provided testimony, as well as to Director Howe, Dr. Hill, Dr. Latortu, and Dr. Johnson for testifying, as well as Associate Director Nixon, and answering the committee's questions. If any member of the public who would like to submit written testimony, the hearing record will be open until Wednesday, February 25th at 5 p.m. Again, my PSA, if you're interested in wanting to serve on a public board or commission, is an excellent way to give back to community. So visit the Mayor's Office of Talent and Appointments to get more information there. All right. This committee's next hearing will be on Wednesday, February 18th. We will hear from public witnesses regarding the performance of DC Health. And then we will hear from DC Health government witnesses on Friday, February 20th. The time is 12:55 and this hearing is adjourned. Thank you. Yay. Yay. Thanks, guys.